Good morning, everyone. Happy New Year. I'm Jamie Strauss-Clark. I'm your facilitator, and this is the Crisis Response Improvement Strategy Committee meeting. I think this is meeting number 19, first meeting of 2024. I'm so glad you're all here today. Before we get started, I'm just going to do the brief housekeeping that I typically do to remind everyone how we use our Zoom tools. So as a reminder, I have two of these. It's been a couple months, so maybe you forgot, but I have two of these slides that I show you. The first one is for CRIS committee members, and the second one is slightly different. It's for community members and guests. So CRIS committee members, as a reminder, if you could please keep your mics on mute unless you're going to be speaking, and your video cameras on if that's available to you. That really helps, especially during the discussion portions. That really helps us facilitate a meeting that comes a little closer to feeling like we're all in a space together physically. Vance, please. If you would like to speak, CRIS committee members, please click on that reactions button, pops up a window, and in there you can click on raise your hand. Chloe, if you could just click that, it'll pop it up. There we go. Raise your hand. And then if you advance again, if you have any comments or questions that you would like to make in written form, CRIS committee members, rather than verbal, please feel free to send me, Jamie Strauss-Clark, a chat. If you're having any technical difficulties, you can send a chat to Brittany Thompson, and she will do her best to help you resolve them, whatever's within her control. Advance, please. And finally, if you'd like to see as many of the CRIS committee members as possible during our discussion portions, please click on that speaker view and change to gallery view. Let's advance to the next slide. Okay, so the slide looks the same, but it's a little bit different for our members of the public. And first, I just want to extend a warm welcome and thank you to members of the public for joining us today on an earlier than we usually do at meeting on a Wednesday morning. Members of the public, if you could also please keep your mics on mute throughout the meeting. The exception will be when we reach the public comment period at the end of the meeting if you've signed up to make comment. And I'll say a little bit more about that momentarily. And members of the public, I'm going to ask you to keep your video cameras off for the duration of the meeting, unless you're making a public comment at the end. I'll call on you when it's time to turn on your camera. And the reason I ask you to do that is because right now we have nearly 70 people participating, and it's a lot easier for us to facilitate if we only see the CRIS committee members on the screen. So that's why I'm asking you to leave your video cameras off for the duration of the meeting. Can you advance, please? Similar instructions, if you'd like to see more CRIS committee members, please click on that speaker view and change it to gallery view. And then when there's no slides up, you'll be able to see the CRIS committee members. A couple more housekeeping items. We have two ASL interpreters joining us today. On the screen right now, you'll see 7-star, and she'll be switching off with Amanda every 15 minutes. They are pinned to your screen. You can unpin them if you don't need that support, or you can leave it up. It's your choice. All right, I think that is, and the last thing I want to suggest is if you are experiencing any unstable internet, you can choose dial-in for audio rather than the internet for audio, and that might work a little better for you. I think that's it for my housekeeping. So why don't we move into our welcome and introductions. And to welcome you this morning, I'm going to ask Levi Van Dyke, one of our CRIS committee members, to say a few words. And great, thank you. Levi.
Thanks so much, Jamie. As Jamie mentioned, I'm Levi Van Dyke. I'm a CRIS committee member, and I'm the executive director of behavioral health at Volunteers of America, Western Washington. Just want to say good morning and welcome to everyone to this first CRIS committee meeting of 2024 on the last day of January. I don't know how everyone else is feeling, but it already feels like more than a month in. So just appreciate everyone being here with busy schedules and everything we have going on. I'm excited to be back here. Looking forward to all the updates that are on the agenda today. There's lots of things. So looking forward to working through those items, hearing updates, and seeing how that can inform our work and setting the priorities for the committee in this coming year. Again, I'd just like to commend everyone for their continued commitment to this work, to this committee, and everything that we're doing. It can be tough. It can be really frustrating. It's not always easy, but it is really important that we continue working through this and that everyone's voices and perspectives are included in this really important work, moving the system forward and making improvements. I just have to say I'm so proud of our 988 centers and the work that they've accomplished. Just really, really wonderful things. And that's a testament to the centers, but to all of you and the work that you do, whether that's at state agencies, our legislators, community members, you really have all contributed and helped make this so successful. I'm so appreciative of that. Really thankful for the subcommittee work too. Later today, we'll be hearing from the lived experience subcommittee and hearing more about how lived experience can guide improvements in the work that we're doing at our 988 centers. And I think I can, definitely speak for all of our centers when we say that we're continually looking to what we can do to improve and provide a better experience for anyone that's utilizing 988. Some things that I'm really excited about from a the 988 center perspective as we move into this next year is moving further into the location-based routing so that we're making sure that people get to the nearest center to them when they're contacting 988. There's been some progress made there, some things in the works. So that's really exciting to know that some things are moving along there. Improvements to the IVR or the front end messaging. So there's already been some improvements implemented. There'll be some ongoing improvements implemented. Might hear more about that later today, but excited for streamlining of that process. And again, just making the experience better for those utilizing the system. And then really excited about just increased community awareness, media campaigns, and more work so that everyone knows that 988's there and the role that it can provide in supporting them. There's also lots of other exciting things going on with 911 diversion to 988 and other things like that we'll hopefully hear about today. But just again, so much gratitude for everyone. Really, really excited to kick this year off. So thank you.
That's lovely. Thank you so much, Levi. And I hope you're feeling a little better. Yeah, well, I appreciate you rallying this morning. I know it probably didn't feel that good to get over here, but I appreciate you doing that. I'm going to just make a tiny change here because, as many of you know, we are deep in legislative session, and Senator Dingra is here, but can only be here briefly. So, and there's Representative Orwell. So I'm going to take advantage of this moment and ask them both we're going to just move up the legislative update just a little bit. I do want to check with our personal story this morning, though, to make sure that's okay. Kathy, I hate to put you on the spot, but if we just took a few minutes to do a legislative update with that.
That is absolutely fine.
Oh, bless you. Thank you so much. Okay, then I'm going to ask Senator Dingra and Representative Orwell. I'm just going to lay this out so you all understand the shift in the schedule. The plan in our agenda after personal story this morning was to hear from our legislators about what's happening in session that's related to all of the CRIS work that we've been doing. I'm going to ask them to do that right now, and then we'll do the discussion about it a little bit later on. So it'll just be a little bit tweaked, but not a big deal. I'm sure we'll make it work. So I'm going to turn it over to Senator Dingra.
Thank you so much, Jamie, and thank you to everyone for understanding. And Kathy, I'm so sorry. But I'll just echo a lot of what Levi said. It's an exciting, amazing time. And I got to tell you, nationally, we're being recognized for the work that we're doing. However, there are some tweaks we're making. So I'll talk specifically just about two quick things. One of them is a bill that was based on, the tour that Rep. Orwell and I and others, so many over here, did all across the state. And what became very clear is that there's a lot of regional efforts going on that really aren't being captured in a holistic way. So I have a bill that basically says that the BHASOs in each region have to coordinate and create like a regional crisis plan. We're still wordsmithing the words to get the concept right so that we're all on the same page on it. This is not about major shifts or changing structures. but really about making sure we know in each region who's doing the crisis work, making sure that they're interacting with each other, making sure that there is a cohesive plan, and then really being able to articulate what's missing in each region, and really making sure our agencies can focus on the areas that have been identified as needing more resources or more work or needing that coordination, but really trying to make sure all our partners are able to do the work that they need to do. And at a regional level, we know what's happening. And that was one of the amazing parts of doing that tour is I remember being in these rooms and someone saying, I didn't even know this resource existed. And that person saying, we've been here for 10 years. And so I'm really excited to really do have this regional coordination that then feeds up into our agency work and making sure, I think just giving agencies more information on what's happening at the regional level and then really doing that coordination. So sorry, I can't remember the bill number, but we'll get that to you. The second bill I have is purely about funding. We had set very tight deadlines in the original 988 bill, and I stand behind every single one of them. But they were, I think, us pushing the system faster to do what we wanted it to do. And so clearly we don't have the entire IT infrastructure set up, and our bills require that to be up and running by June. So I just have a bill that moves those deadlines. We're pushing it a year and a half. I wanted to do a year, but I didn't want to freak people out. So I think we can have that conversation on whether a year and a half is reasonable or whether a year is reasonable. I know we're waiting for Vibrant to do a lot of work, and they've reached out wanting to have a meeting. I know California is doing something different with their platform. So I don't want to unnecessarily delay where we are, but we do know practically we're not going to have a platform up and running by June. So we're moving those deadlines, and that's very much targeted towards the technology platform. For our lovely facilitators, what that does mean is that CRIS will have to continue for longer because of those deadlines. So sorry, CRIS members, if you thought you were done earlier, we will have to have that conversation on how much longer we would have to delay this. So more on that. But those are the two big ones. And I'll just say there's a lot of other investments happening in substance use disorder and mental health that really is going to help this entire system. So more on that, but those two are the specific bills related to 988 and the work that we're doing here. And I am happy that to take any questions, and thank you so much, Anna, that the bill number is 6251. And I'll just say it's amazing to see so many CRIS members come and testify on the bills. It really warms my heart to see you guys all there in Olympia virtually or personally doing the hard work. So thank you all so much.
Thank you, Senator Gingras. I'm going to see if Representative Orwell has anything to add.
Yes, I have some things, but I want to start by just saying everyone's just doing such an extraordinary job, and I am really proud of our work. And we hear about it because we work with people in other states. And I was in Vancouver right before session, and one, just a shout out to Seymour, who's doing incredible mobile team outreach there. And the Oregon folks said, oh, can we be part of your Native and Strong line? So the other states are watching us and are thankful for what we're doing. I also want to thank Senator Gingras. I don't know if she bounced off, but she's just been such a great partner in the legislature. And I don't know if she mentioned her youth 23-hour facility bill, but we're really happy about that as well. So a couple things. I have a 988 liability bill, which was asked to sponsor on behalf of the Healthcare Authority. I think it's a really important bill as we're trying to do the rapid response to 988. Also, as we're having EMS and fire, reach out and take people to the receiving centers. We want to make sure people know that with this intense work that we're also making sure there's some protections for them. And I think it's one of the tools. So that's House Bill 2088, and appreciate all the support on that. I also been working with Representative Canoff, who's a rock star, And she's doing a bill that will codify the Native and Strong line, as well as the expansion of text and chat, which of course will ultimately have to be approved at the national level. But again, want to thank VOA and DOH for their work on this. And Vibrant has reached out to us. I know we're trying to coordinate a time to meet with them to talk about the platform. I'm glad we're taking more time because we want to know what all our options are so we can make the right path for Washington. I've also been working with Patty Murray's office, and they're reaching out to the FCC to really see what we can do with the routing and seeing if that could move more quickly as far as the area code. So I feel like there's a big team working on all of this. Hopefully we can get some good stuff done. The last thing I'll say is there's also a lot of capital budget investments, really communities that want to do the receiving centers. We're really carving out dollars to make that possible and really want to see those all over the state. So again, great work. Happy to stay for a minute if people have questions, but appreciate the work you're doing. Oh, and I'll say one more thing. The co-location of 988 and 911 is just awesome. And so I want to thank all the call centers that are working on that. We're learning a lot, and clearly a lot of the calls can be diverted to 988. But those partnerships are very meaningful. I just want to thank everybody who's really been part of that.
Wonderful. Thank you so much, Representative Orwell. And are you, I know you said you could stay for a little bit. Do you have to run to any sessions this morning or are we?
I do, but I can stay another like 10 or 15 minutes. So.
Okay. Here's what I'm going to ask, because I want to be respectful also of Kathy Callahan's time and our schedule. Oh, Kathy just shook her head, so it sounds like she's got a little. Am I here? Okay, she's okay. All right, please let me know, Kathy, if you need to get going. Let's pause for a minute. Does anyone have any questions for Rep. Orwell while she's with us? And we'll get an opportunity to discuss legislative session later in our agenda. I just wanted to make sure we took advantage of.
Not a question.
Yes, please, Kathy.
Thank you, Tina. Thank you, Senator Dhingra. I really do appreciate everything you're doing to support this and the 23-hour crisis relief centers going forward as well.
Thank you.
Thank you.
Team effort. I appreciate that.
Does anyone else from CRIS have a question for Representative Orwell? If you all think of anything, you can throw it in the chat and I'll make sure that I get those to Representative Orwell and Senator Dhingra. All right, well, let's dive right back into our agenda then. Thanks everyone for your flexibility, for us doing a little shift to make sure we could have the moments with our legislators. I think here's what I'm going to do. I think what I'm going to do is move to personal story now, and then I'll go back through the rest of our agenda. And that way we can kind of stay on the timing that we promised for the personal story. So with that, I am going to turn it over to our lived experience CRIS committee member and steering committee member and all around wonderful person, Bipasha Mukherjee, who's going to introduce our personal story today.
Thank you, Jamie. It's good to see you again. Always kind to me, I appreciate it. And since it's officially January still in our corner of the world, let me wish you all a happy new year still. And it is my honor to introduce you to our speaker today, Kathy Callahan, who actually served in the beginning on this very committee as a lived experience representative. She voluntarily stepped away mid-2022 because she works full-time and was raising at age 63, as she said, 2 of her grandkids full-time as well, and said she could not give her role on the CRIS the full attention it needed and deserved. To me, that in itself highlights how seriously she takes her roles. She serves today as a kinship caregiver, a new thing I learned from her, which is different from being enrolled as a foster care parent. She serves as a kinship caregiver to her 13 and 5-year-old grandbabies today. Kathy was born in Texas, raised in SeaTac. She now lives in Federal Way. Kathy, you shared with me that you had a good childhood. You stayed out in the neighborhood till the sunset. You drank water from the garden hose. You were always a helper playing games in childhood, setting up pretend daycares in the patio at the back, taking care of little kids. And in college, you had some experiences that led you to seek counseling, and you still believe in the power of counseling today. Kathy worked for Boeing for many years before one of her kids was diagnosed with a serious mental illness. That's when she turned to learning about and starting a career in behavioral health. Kathy was the first batch of certified peer counselors in Western Washington and has been working in that role for over 20 years. Kathy loves to cook all kinds of things, checking out new cookbooks from the library regularly. And she loves cross-stitch needlepoint, though she has almost no time to do it. Her life is full of stories rich in lessons we could all do with knowing. I know she won't be able to share all the stories because how do you capture a life in 10 or 15 minutes? But I know whatever we hear today will open our hearts and minds like it did mine. Folks, here's Kathy.
Thank you, Pasha. You're too kind. So this is January 2024. About a year ago today, I was carrying my daughter's ashes from the funeral home to the car. It reminded me of carrying her from the hospital into the car to go home for the first time. And then I had to bring her home for the last time. I want everyone to understand that addiction, particularly the opiate epidemic, which fentanyl is what killed my daughter. The medical examiner was very clear to me that she died of acute drug intoxication, but had there not been, the drugs had not been laced with fentanyl, she probably would have not died at 33, leaving at that time a 3-year-old and a 9-year-old without their mother. It touched me. It touched those kids. Sadly, a lot of people who become addicted do have children. I'm not sure where the state of Washington thinks they go sometimes because there's not a foster care system. There's not an orphanage system. There's still so much stigma attached to mental illness and addiction that a lot of people wouldn't come forward and ask for help. I've been trying to reach the preceding people, the grandparents, the aunties, the adults that step in to the lives of those children, as well as the children themselves, and to try to get the addicts some help. My daughter was 3 years in recovery when her first son was born. She told the people in the hospital she was in recovery from cocaine abuse. They gave her a drug. They told her it was not habit forming. She had a terribly botched cesarean section and had quite a bit of pain. And they told her that it would be okay. And it was Oxycontin, and it wasn't okay. And she went from there to crushing Percodan and smoking it, to smoking heroin, to shooting heroin, to smoking fentanyl in the course of just a few years. There was probably over a dozen hospitalizations, rehabs, jail, downtown emergency services center, which I bless them. And it wasn't like we didn't try. She tried, and I told her son that, how many times did mom go to treatment? More times than he could count, he said. And I said, she tried real hard, huh? This is a devastation on a community that you see substance use disorder and mental illness go hand in hand. I work for Public Behavioral Health Agency. I volunteer on the statewide Department of Health 23-hour crisis response center committee, ad hoc, whatever. I'd like to see more done. 988 is something that absolutely excites me. The first time I bought a phone for my grandson at Walmart, I noticed that there was a little charge on there for 911, and there was a little charge on there for 988. And I put it on my wall in my office and highlighted it because I was so grateful that we were moving forward. And that was before it ever launched. So we're doing great things, and we could do more. I know that 988 is a crisis prevention, the big word being prevention, and prevention is big. But when I lost my daughter, and here I am, 20 years, I'm a resource queen, ladies and gentlemen. I did not know the difference between the medical examiner and the coroner's office. I did not know anything about the Indigent Remains program, and kind of wish I didn't. I didn't know how to get a copy of a death certificate. I didn't know that you're supposed to call Social Security within 48 hours so that no one steals your dead child's identity and Social Security number. There were a lot of things I didn't know. I didn't know where to reach out for grief and loss. I was super, super lucky. But I'm hoping that 988 can be an information and prevention line that we can help people like me that call in and say, what am I supposed to do now? What do? I don't know where to go. I'm middle class. I don't have an attorney. I was just very lucky. I knew enough to call Catholic Community Services and to call the Washington State Aging and Long-Term Disability Service Administration, and I knew enough to call the King County Kinship Collaboration. And so every time, I understand in King County, every day 2 people die of fentanyl-related death. And of them, let's just say only one of them had kids, not both of them. Where will those children go, and who will support them? The foster system is overloaded, broken, whatever you want to say. People like grandmas and grandpas, aunties and uncles, best friends from high school, adult siblings taking these kids to raise. I have seen in the state of Washington, in other states like Ohio and New York, I've seen some of their Purdue Pharma, whatever, settlement money go into helping relatives raising relatives' children. In Washington State, I have not seen any of the, I think it's like $851 million now, go to support kinship programs for these kids, for them to go to camp, for them to have grandma and grandpa are on a fixed income maybe, and they can't afford cleats and uniform for them to play soccer. There is cobbled together a very small, underfunded local charity here, scholarship there. It's not going to sustain us. There's 51,000 children like that in the state of Washington, and they are getting bigger every year. 10 years ago, when I adopted Matthew, there was at least 30,000 fewer children, and those are only the ones that we know about. People of color, families who've had negative experiences with the systems of care, they tend to not tell anybody. They'll forego TANF or food stamps or WIC or whatever programs that would make their lives easier, even school lunch programs for free and reduced lunch. A lot of times they don't even know those programs exist because they didn't need them when their children were growing up. So we have a big job. We've done amazing things. Everybody that's been involved in this should be proud of themselves, but we have a ways to go. We have a little innocent population that didn't do anything wrong, that's not getting the support they need, and that's the children and their caregivers. I'm 64. Matthew's 13 now. I've had him since he was 3 days old. Amelia just turned 5. Amelia was born addicted to opiates. She has OT, PT, SLP, all kinds of services through public schools and health insurance. But at 64, keeping up with that little sprite is whew. But we're doing it. And I just want to raise awareness that when that statistic dies, it affects the entire community, just like their addiction affected the entire community. And we're out here. You guys can ask me anything by Pasha. You can put my work email address in the chat if you'd like, if anybody has questions afterwards, how you can get involved, how you can refer someone for services, or get them some kind of support. I have a drop-in group that's open to anybody that lives in King County. And actually, I kind of just don't even care if you don't live in King County. It's on Zoom on Mondays from 2 to 4. And we exchange resources and we help each other.
All right, Kathy, we'll put your email address in the chat. I think
Thank you for your time, especially thank you very much, Representative Orwell and Senator Denga. I really appreciate your listening.
yeah, thank you, Kathy, for sharing some of your stories with us today. When you reached out when your daughter died, it broke my heart, but it also enraged me knowing that she had told the doctors that she has a history of addiction and she was still given OxyContin. That kind of threw her back into addiction. And you said you wanted to share your story, but you were not ready. Then I'm so glad that I stayed in touch with you and that you are here and that you've shared the story with us. And just listening to your stories of how much you've done as a parent, a grandparent, helping others over and over again really showed to me that you put your heart into everything that you do, which is deeply inspiring to me. You shared with me your ethos of each one, reach one, teach one. This is truly how we make change from the grassroots level, one human being at a time, never giving up, because no matter how many times any of us falls and fails, each life matters. I just wanted to let people know in the CRIS that the Lived Experience Work Group has been reminded, especially by CRIS member Michael Robertson, who works as a CPC, that we are not centering the drug epidemic that is raging in the Northwest. So we decided to bring that matter to the fore and ask CRIS to pay it its due attention. And thus the intention centering of Kathy's story as we start this year. Just today I read that Portland has declared a state of emergency for a limited time for the fentanyl crisis. So on behalf of the lived experience community, it is my heartfelt request that we keep this epidemic squarely in our minds and in our discussions as we continue to delve into building our behavioral health crisis response system this year. Thanks, everybody. Thank you again, Kathy, and back to you, Jamie.
Kathy, I'm getting so many chats from people who are so moved by your story. I gotta tell you, as a mother, listening to you talk, I'm really grateful for you coming today and sharing your story. And I see in the chat notes from people saying they were wondering about how best to support families providing kinship care in similar situations. So you raised an issue that I think is meaningful to a lot of people on the call today. So thank you.
Thank you very much. Thank you for the information on the bereavement program. And I now have a list that's 2 pages typewritten long of grief and loss resources for children and families. My grandson will be, my other grandson will be 13 this summer, and I'm hoping they can go to the Wild Grief for teen boys and young adult boys, where they go out into in a hike and they release the grief physically, and while they're out on top of the hill or wherever they've climbed, and come back. And I wish I was in good enough shape I would go with them, but there's a plethora of resources out there. There are ways to do this, but nobody really, writes that down in their book of, I should know what to do in case my kid has an overdose and dies. I never thought it would happen. I'm sure she didn't think it would happen to her, but it did, and it does. And it breaks my mama's heart when I think of all the kids that not only did we lose our children, but now their grandchildren, our grandchildren, are impacted. So, moving forward, thank you all very much. The work you do is extremely valuable. And never doubt that for a minute, and never doubt that you're not enough, because every single person on here makes a difference. Thank you very much.
Thank you, Kathy. And as Bipasha said, thank you for offering your email address for people to ask questions. There it is in the chat. Kathy, I have a couple of community members who've written asking if that resources page that you were talking about, where you've got a list, is that a publicly available resource or something that could be shared with the group?
Oh yeah, I can send it to Bipasha.
Okay, great. We'll share that along. Thank you so much.
Okay.
Yeah, I think you're right. I think so much of this is about connecting people with the resources that exist out there. And it sounds like you've done a lot of the work to find those. So,
And if you don't find it, build it. I've done that too.
right, it's another thing you have done. And I'm also hearing from folks in the community who have observed similar experiences where loved ones have gotten addicted following treatment in a hospital with opiates. So, thank you for being here today. It was good to see you again. I'm going to go ahead and walk us through the rest of our agenda for today. So, Chloe or Brittany, I'm not sure who's controlling the slides today, but if you could put them back up, please. Chloe's sharing slides. Thank you, Chloe. All right, so let's walk through our agenda today. So we're going to go back to the legislative session discussion and process a little bit about what we learned from Senator Dingra and Representative Orwell, and also hear from some of you. And then we're going to move into hearing from our state agencies about their priorities for 2024 related to CRIS Committee's work and have a discussion there. We'll aim to take a 10-minute break at 10:30. And when we come back at 10:40, we're going to discuss or hear from the Lived Experience Subcommittee. Levi mentioned this earlier, who's going to share with us a little bit about their plans to engage lived experience in informing systemic improvements. After that, we're going to have a group discussion on CRIS priorities for 2024, really to lay the foundation for the coming year, since this is the first meeting of 2024. We'll do action items and next steps, and then we'll move into our public comment period at 11:48. I do want to just briefly remind everyone, since like I said, it's been a minute, about our public comment process. The public comment period is for members of the community, so not CRIS members, but members of the community who are joining our meeting today. If you would like to make a public comment, please send a chat to Brittany Thompson and we'll put you on the list. We will take public comment in the order in which people sign up. I'm going to have a time limit for each comment, and that just allows us to make sure we end meeting on time and take as many comments as possible. The time limit is 2 minutes. However, I do reserve the right, if we have a long list of people who want to make a comment today, to shorten that to 90 seconds. And I'll have a timer on the screen to help you follow that time limit. I am going to strictly enforce those time limits, again, just to make sure that we're being consistent. However, if you need an accommodation and you might need a little more time, please let me know ahead of time so I can plan for that. And you can do that when you send the request to make a public comment to Brittany Thompson. A couple more things to note. Our CRIS committee members will be listening but not responding to any of the public comments today. They will be in the meeting minutes. And if you have a written version of your public comment, please do send it in to us. It does help us make sure that we have the meeting minutes correct. A couple more things. If you prefer not to make a comment on a screen but do have something to say, please do send your comment to our email box, and I'll put that in the chat momentarily. We do compile all of those public comments and share them with the CRIS committee prior to each meeting, so they will see it, and it is just as impactful as speaking in a public meeting. Oh, thank you, Brittany. Brittany just put the email box in the chat. So that's another option for you. Also, if you sign up and you don't get called because we've run out of time, again, that email box is a great option. The CRIS committee will see your comment. I think that's it. So again, please do send a note to Brittany Thompson if you'd like to make a comment today, and we will get to that in the last 20 minutes of our meeting. All right. So with that, let's go back to our legislative discussion. You heard, and we can take the slides down, please, Chloe. Thank you. All right, so you heard from Senator Dingra and Representative Orwell about what they're working on in this legislative session related to the CRIS committee work. I know there are many of you, in fact, I'm realizing now that it may be that some of you who are working in legislative session this year or involved in legislative session weren't able to come today because it's legislative session. But those of you who are engaged, what are you seeing that's related to behavioral health? Do you have anything to add to what we heard from Representative Orwell and Senator Dingra. Any CRIS Committee members have anything to add? Anna.
Hi, so yeah, I'm seeing there's a lot of great bills this year for behavioral health. There's a lot of focus on youth behavioral health too, which is great. So there's several bills, one on encouraging schools to teach social and emotional learning at the school. And it's not a mandate, because I think that was one of the issues people had, is that it's a mandate and some schools don't have the resources. But what this does is it encourages schools to teach it, and then schools can get funding to teach social and emotional learning at their school, and they prioritize schools in high poverty areas and high need areas. And then there's also one on establishing a statewide network for student mental health. And so we're pretty excited about that bill as well. And then addressing the behavioral health shortage. We're really excited about Senate Bill 1946. And what this does is it sets up a behavioral health scholarship program through the Washington Health Corps. And so people that are interested in pursuing a behavioral health profession can apply to get this conditional scholarship. And so it's a conditional scholarship, which means that when they graduate, they will be obligated to work in either a rural area or another area that is, a marginalized area, an area that really doesn't have much behavioral health resources. So they'll identify those areas, and then the students will have from what I'm understanding about it, 2 to 3 year commitment to work in those areas. So what this bill will do is, well, first of all, it's going to make behavioral health professions more accessible to people, because it's a scholarship, they don't have to pay it back. And it'll also bring more workers to marginalized communities. And what I'm really excited about is that behavioral health seems to be continue to be a priority. It was a priority last year, and it seems to be even more so this year. We're gaining more allies. I'm seeing more legislators that haven't sponsored behavioral health bills in the past become more interested in behavioral health. And so I think, this is a quick session, so we'll just have to see how many bills move forward. But I think, some of these bills, and I would say to everybody, if it doesn't happen this year, we just keep plugging away, and we keep, NAMI is going to work on bringing back some of these bills for next year. And also we're going to continue to explore, other issues that we can bring forward to the legislature to perhaps see, if there's any state policy that can change around improving the behavioral health care system.
So Anna, it sounds like you're feeling, I don't know, is optimistic the right word, that there's more attention being paid in the legislature to behavioral health?
Absolutely. And again, for NAMI, we're gaining more allies, especially from both sides of the aisle, which is great, and from both the House and the Senate. And so, my hope is that this momentum will continue into next year. We're going to have a new governor next year. Governor Inslee has really spent the last few years focusing on behavioral health. And so hopefully the new governor will also do the same.
Thanks so much, Anna. Other CRIS Committee members have anything to add to what we've heard from Anna and Representative Orwell and Senator Dingra about what you're seeing in session? Michelle.
Well, I just am still so thankful for Kathy sharing her story with us today. I also was incredibly moved, but on that note, I do want to share a little bit at a very high level, and I don't think Amber's on, right? But around some of the work the state is doing around fentanyl and overdose and opioid crisis in our state. One piece is there was a lot moving in legislative session, lots and lots of bills related to different ideas about how to do that. And the state is working through the legislative process to make decisions on the next round of opioid settlement funding. So the governor had some recommendations in his budget, and the legislature continues to consider that. Some of the state's efforts were also highlighted in what's called the public performance review, where high-level goals that the governor's is tracking with state agencies, where there's kind of a public report out on those. And there was a session, I think it was last week, on opioids and overdose crisis. So I can send the link to Jamie too, if you want to hear some of the work highlighted that's happening at the state. And there were also a couple personal stories that were part of that report out with the governor. So just wanted to share a little bit about some of the next steps that are happening at the state level to address this crisis.
That's great. Thanks so much, Michelle. And yes, Kathy said she'd like to see that report. So if you don't mind sending that along, I will share out the link. Vipasha.
I'm just going to kind of tag along with what Anna mentioned, since we've talked about staffing. It's not directly related to the legislative session this year, but in the past month, I have heard about how high the bar is to actually pass the exam to be licensed, for example, as a social worker. I talked to someone who said they worked 20 years in the field, but they still failed that exam. And I was talking to Kristen Wells, who is one of our work group lived experience people. And she said she had to take a class to figure out not just how to answer the test, but how to actually be able to pass the test, not the specifics of the content. And the person who trained her had failed it 3 times before they passed. I mean, if that's as high as the barrier is to even be licensed, if you're fortunate enough to even get the education, and there are other barriers about paying for that licensing every year, renewing it. But the one thing that I want to say is a lot of people who worked in the field said that the test doesn't really match what happens in real life in social work, which is kind of weird to me. Why do we have tests that don't really prepare the person to go out and get working? So I just wanted to put that on the record. That's basically what I want to do, because if we're talking staffing, we have to address multiple aspects, and this is one of them. Thank you.
Thank you, Vipasha. And I think we should flag that we are going to be having discussions throughout this year about the system gaps and where we need continuing to have that conversation about system gaps and where we need to make adjustments. And I think what you're talking about is along those lines and really important, that if we want to create more of a pathway for workforce. Let's see. I've got a couple of things in the chat here. Oh, here we go. This one's from Michelle again. I'm going to send it out. This is, bear with me just a second. Okay, here's another link from Michelle. Any other contributions from CRIS members regarding this year's legislative session and how it might, what you might be observing that relates to the CRIS Committee's work? Well, and then, oh, wonderful. So Chief Harding sent me a note. House Bill 2245 addresses credential for co-response certification. Chief Harding, do you know who's sponsoring that one?
Yeah, CROA was the agency, and then it was picked up in sponsorship. I've forgotten which senator's taken it, but it's moving ahead. It's got good support, bipartisan support, and it would really help with not lowering the bar, but broadening the ability to license co-responders, and without necessarily requiring that high degree that it has required in the past.
And I have a note in here in my email, actually, from Nicola, who flagged this particular bill. So I'm just going to share this as a brief summary of the substitute bill here.
Great.
That it's House Bill 2245.
And Jamie, Nicola may be saying this in the chat, but Brooke Buettner had asked for CRIS members who were interested to join her for a conversation. We reached out to you all at the end of last year and are happy to set up that meeting. We just paused at the end of the year getting the report out and all the work we had. So if you If you haven't responded to Nicola and want to join a meeting, please just chat her.
Thanks for reminding us of that, Betsy. I'm sure I certainly forgot what the emails were from the end of last year, so I appreciate you flagging that. Oh, Puck asked, can you repeat that, Betsy? About the meeting?
Yeah, Brooke Buettner had reached out about this legislation and wondered if CRIS members might want to contribute to some thinking and a conversation. And so we had gathered CRIS member names to set something up. And so please just chat Nicola if you'd like to be part of that conversation.
Okay, anything else on the legislative session before we move on? Oh, and Vipasha is asking too if it's relevant. Maybe Brooke can give an update at our meeting at some point. So we can make a note of that. All right. We
2088. Okay.
Well, I'm gonna remind everyone to I was just gonna remind everyone, keep your mics on mute if you can, unless you're speaking. Thank you. All right, so we're moving ahead here. Let's move to our discussion on state agency priorities for 2024. And so our objectives for this conversation are to, of course, ensure transparency and demonstrate progress, make sure we're connecting the work that our state agencies are doing with this CRIS process and all the work that you've done together, and also just keep you informed so that it can inform your work and you're building what's already being done. Hopefully everybody got that newsletter that was sent out last week. I'm going to ask Tisha Kirschbaum from HCA to present the focus areas for Healthcare Authority. And then I'm going to ask Michelle Roberts to do the same for Department of Health. And then we'll have some Q&A and discussion. So I'm going to hand it over to Tisha.
Good morning and thank you. I think there is a slide or a visual that we submitted. Is that going to be shared now? If not, no problem.
Yeah, Chloe, can you put those slides back up, please, in advance?
I'll just do, so we're doing HCA first. Yeah.
Yeah.
Perfect.
Thank you.
Well, good morning, everyone. It is great to see all of you. I am Tisha Kirschbaum, and I am the Deputy Director of the Healthcare Authority's Division of Behavioral Health and Recovery. And I'm really excited to get just a couple of brief minutes to share a little bit about the Healthcare Authority's top priorities connected to 988 for 2024. As always, we want to build what we're doing for the next year off of the wonderful information that was in the December 2023 CRIS report. So we kind of have three big buckets of work that we're separating this into. And again, this is not an exhaustive list of everything that we're doing, but just kind of overview of some of our top priorities we thought you might be interested in. So we want to continue to focus on our work on system quality and oversight, system infrastructure, and then of course, services and funding. So to start with that first bucket of continuing our work on system quality and oversight, we do have a strong emphasis on regional coordination and training collaboratives. Our goal is to work with our regional partners to improve collaboration and create performance metrics such as response times for mobile responders, and looking at metrics connected to somewhere to go to track outcomes that are both quantitative and qualitative. We are so excited about the work that is going to be occurring over this coming year from the Lived Experience Subcommittee, with their goal of hearing from individuals who have participated in the system to be able to get those stories. I can't tell you how excited I am for this work and how we're going to be able to use it to better improve the overall system, and just thank you for that commitment. The Healthcare Authority will work with our partners in regions to develop a feasibility study for regional training collaboratives to improve cross-training, and with our system partners and system users. Our goal, as always, and we strive to develop a system that helps people access services quickly. Endorsement standards for mobile rapid response crisis and community-based crisis teams to ensure that teams are highly qualified, available to respond quickly, and transport if needed. And of course, before the endorsement standards are published, they will be reviewed with partners to ensure that they work and really address the gaps in the system. Moving on to system infrastructure, we are working in close partnership with the Department of Health to acquire enhanced funding, also called federal match, or being able to pull down some Medicaid to be able to build the integrated crisis response system. Part of the reason that we are pursuing those Medicaid funds is so many individuals who do participate in 988 and mobile rapid response teams, and also who will be going to crisis relief centers, they're Medicaid eligible. So because of that, we are attempting to pull down some Medicaid funds to help with the building of this system. We have submitted our application to the Centers for Medicare and Medicaid, CMS, back in December, and we hope to get approval in February of 2024. Another very high priority, of course, is working very closely with the Department of Health to develop an RFP for vendor selection to build the integrated crisis response system. I've also heard this called the system of systems. The goal is to select a vendor to build the best possible system at the most affordable cost. Our joint goal is by the end of the year, we'd have a vendor selected, onboarded, and then at the very beginning stages of building the system. So services and funding. As we continue to build a system that responds using best practices to those who need an in-person response, this includes mobile rapid response crisis teams and community-based crisis teams who meet the endorsement standards. Of course, also supporting the stand-up of crisis relief centers. To support both of these efforts, we'll be rolling out grants for startup for crisis relief centers and for teams to meet those 1134 endorsement standards. Another best practice is how we support youth and families using the mobile response and stabilization services, often called MRSS. Currently, we are piloting this work with a goal to roll out statewide, and we're making great progress in those efforts. We are also partnering with the Tulalip tribes and the Nisqually tribe with mobile crisis grants. These grants will be used to implement mobile crisis teams that will work more effectively for tribes. And of course, I wouldn't be able to end without a quick note about our continued focus this year. We'll be completing the actuarial analysis to be able to determine the rates for teams who meet the endorsement standards. Thank you.
Thanks, Tisha. And I realized I just want to pause for a moment. I know we did a big introduction of you at the steering committee meeting in December, but I'm not remembering if we made sure that the whole CRIS committee and all the community members knew that you were joining the CRIS and the steering committee on behalf of Healthcare Authority. That may go without saying, but would you just mind really briefly just reminding everyone of who you are and your role on this? And I apologize for not asking this earlier.
No, thank you for doing that. Hi, everyone. I am Tisha Kirschbaum, and like I mentioned, I'm the Deputy Director for the Healthcare Authority's Division of Behavioral Health and Recovery. As many of you are aware, Carrie Waterland stepped down from the Healthcare Authority back in December, and as she left, then I was asked to come in and represent the Healthcare Authority on the steering committee. So I've been very involved in HCA's work connecting to 988. I was excited to be able to fulfill Carrie's old role here on the CRIS committee. So thank you.
And we are delighted to have you. Thank you so much, Tisha, and thank you for that thorough presentation. I'm going to move on to Michelle, and then we'll do some Q&A for both Tisha and Michelle, and it can be on what they're presenting today and also anything that you read in the newsletter. So Michelle, you're up.
Great. Well, good morning, everybody. Michelle Roberts, and I represent the Department of Health on this committee. I serve as our Assistant Secretary for Prevention and Community Health, which is where our injury and violence prevention and our 988 team sits. So really honored to be here. And that includes the state support for the 3 988 call centers in the state. So next slide, please. Okay, well, Tisha was a very concise approach by having her priorities on one slide, but I have several slides, so I'll kind of run through them quickly, and then all of them are covered in more detail in the newsletter. But just kind of a highlight of some of the things where, like Tisha said, we're working on at the state and here at DOH that really align with some of the priorities of CRIS. The first is really excited to share we're close to launching the 988 awareness campaign. So kind of multimedia campaign coming, thanks to all of you, especially the Lived Experience Committee, who've helped us along the way to inform the campaign materials and what's going. So it's right now we're in kind of a phase of creative concept survey to gauge general public and priority audiences' opinions of a couple of different concepts. And one will be used to create the campaign brand. So concept testing is wrapping up today, and we'll have more to share later in the coming weeks about what that looks like. And then the rest of the kind of what's called assets or pieces of the campaign will be built out around that. And we expect to fully launch the campaign in March. But right now, we are currently bolstering promotion and awareness of the Native and Strong Lifeline, and that work launched at the beginning of January. So much more to come, and we'll keep everybody really close as that work continues. We're also expecting some additional campaign work at the national level, but don't have much intel yet on that as well. So next slide. Okay, another big area of work for the department, which was outlined in the original 988 legislation, which is that we need to go through a process to establish state administrative rules around implementation of the contact hubs as they were outlined in the original legislation, which can do additional things, including in addition to the 988, but triage, care coordination, referrals, so that work is in a several step process that state government goes through to establish rules. And if you don't know what, when we use the word rule, that is kind of like the administrative operations aspect of a state law. And there's a process the state has to go through, which is what the CR 101, the CR 102, and CR 103, those are the official steps. Kind of the 101 was like, hey, we're doing rulemaking. The 102 is actual language. And then the 103 is when we have final. So those are the steps any state agency takes. There's public input and comment along the way. We have been doing a lot of engagement and collaborations, listening sessions with the public, with interested stakeholders, with the Lived Experience Committee, with tribal nations and organizations. So that's the work that's happened so far. That will continue, and moving towards towards what would be the draft rule language, which would be the CR 102 stage, which would help, and we're aiming for in early summer, and then hoping to have that final language by around the end of the year. So there is continued engagement on this, and if you are interested and not on the interested party list for this, please let us know and we can get you added. So next slide. Really excited to share a little bit more about our work in partnership with kind of a pilot project between the state, 911 call centers, and our 3988 call centers. So this is sometimes has been previously been referred to as the 911 co-location work, but the kind of new term within the broader national community is mental health call diversion, and it's better aligned with what the work is and what the best practice is. And this is the pilot program really supports each of the 3 988 Lifeline crisis centers to partner with a 988 call center or PSAP in their primary geographic location, where 988 call centers are embedded in the 911 call center processes, talking about the diverting appropriate calls from 911 to 988. And 988 Lifeline centers are also tasked with and funded to conduct community engagement activities to support this work, to make sure we're really bringing the public along and getting some public input to help guide this work. So this work is that we were doing a planning phase last year. The official pilot launched on January 1st and goes through December 31st of this year. And this will help us contribute to kind of quantitative and qualitative data collection so we can really develop some comprehensive understanding of this work and some best practices for our state in an ongoing fashion. Next slide, please. Along with the pilot project, we also received a grant to support and the development implementation of warm transfer protocols from 911 to 988. So I'll be clear, every one of our call centers in the state has worked with 911, probably close to a daily basis. But we're working on, is there opportunities to standardize and consider alignment around this? And that's the work. And that's really what this, in addition to the pilots we were just talking about, what this grant would continue to help think about protocols to support appropriate diversion of 911 calls that could really, hopefully, one, alleviate strains on 911 resources, but also really importantly, improve outcomes for people in crisis. So we're working on an environmental scan of current 911 processes for mental health crisis calls, develop mutually agreed upon and adaptable statewide warm transfer protocols, and develop a train the trainer program for 911 telecommunications in order to embed these protocols. And obviously we're working really closely with our partners at 911, including Adam on this call, Adam Wasserman, and all the 911 PSAPs around the state. Okay, next slide. One of the pieces that I'm really proud of, and I really get to brag on behalf of, I guess, my team's work, but definitely the 3 call centers in the state, is just ongoing quality improvement updates. You'll see that map, if you can't see, is the geographic kind of locations of the 3 call centers, which counties they serve, and what some of the backup. So one of the exciting new pieces is to ensure that we have a very high percentage of calls that to 988 to make sure they're answered in state. This at the end of this last year, the call centers are now backup for each other for calls. And that's really critical because there was a little bit of backup call centers happening in the state, but sometimes there would have an opportunity that those calls would be kicked out of state. Now the backup, and that would be if one call couldn't be answered because of a high call volume, who would answer that call versus the primary call center. And now those calls would be routed to another call center in our state. So that's really important quality improvement for our state and continuing to make sure we have local resources answering our calls. We also have stood up some additional text and chat the call centers have in our state. So Crisis Connections, in addition to Volunteers of America, is providing text and chat services in our state. And Frontier Behavioral Health hopes to provide backup text and chat services later this year. So some really important improvements to the work. And another piece that is really exciting that's happening at the national level, but really impacts some of the feedback we get. And that's to what is the recorded greeting at the national level for when anybody calls into 988, and which is called the IVR. And so Vibrant, the national administrator of all 988 call centers across the country, who is responsible for all that initial routing, has piloted a shortened message, which, and it's the previous one took 45 seconds to get through, and we've heard some concerns about that and have been regularly sharing and working with our national partners. And so they think we have been a leader in prompting this change, and the new shortened greeting takes about 30 seconds and also offers callers a bypass option to be connected directly to a crisis counselor. So really excited about these changes happening at the national level, and really will improve services here in Washington. Next slide. Just wanted to highlight a few other work happening. We have some additional federal grants that are supporting continued staff and workforce efforts within each one of the call centers. It's also helping expand the reach of our 988 campaign. And we're working really closely with Healthcare Authority on some peer community crisis response teams. So, which is in alignment with that grant work. We've also been working with Healthcare Authority on and the BHASOs and the 3 call centers around kind of working towards future state about how 988, excuse me, call centers and the regional crisis lines work together. And so those teams have developed some recommendations that Tisha and I as executive sponsors have reviewed. And we're working to all of our stakeholders and others have helped kind of identify some gaps, and our teams are working to do some planning around that. And I think we'll have more information to share with everybody this spring about what's coming next. And Tisha already mentioned the Medicaid match work, so I'm going to skip over that. And my last slide, please. Which, just to let you know, we have got some new fact sheets and we've worked with DOH around kind of the call center work, and some of the hot topics that are happening include what happens when you call 988, fast facts about 988, what 911 fire and EMS and first responders need to know about 988, and a new fact sheet to support the Native and Strong Lifeline. So we'll make sure all of those are wildly, but also widely available to everybody. So that's it for me.
Okay, I'm going to open it up for questions. Chloe, if you don't mind taking down the slides. I got a couple of questions from Michelle in the chat. Michelle, I just emailed them too, so you can see them in writing. Sometimes that's easier. But yeah. Kashi asks, how can CRIS committee members get info about rulemaking sessions?
You can be added to our interested party list. So I'll make sure, Kashi, we can get you added. Anybody can email myself or Jamie or our team. I think I'll find out, my staff can somebody to put the list, the email address to be asked to be added in the chat to Jamie, and we'll get that posted here. Also, we've been including updates in every CRIS newsletter about the rulemaking and the sessions there. So watch for information there as well.
Great, thank you. And then from Kim Mosolf, I'd love to hear more from Michelle and DOH about this MHCCDI pilot work in terms of what they've learned about how to train on and identify calls that truly require 911 police response versus 988 crisis response. Something we talked about a lot in our first responder subcommittee, and she's very interested in this. So Michelle, anything on that?
Kim, we're working, that's exactly what the pilot is to do. And I think, is there an opportunity, if we've not been yet, to make sure we're talking about the pilot work in that first responder subcommittee, and definitely willing, as we kind of start, since we're just kicking off the pilots, it's a little early to have that in any kind of coordinated fashion yet, but we are happy to be, and will keep reporting back to here and think about, can work with Betsy and Nicola and when the right time may be for presenting that data out, but definitely want to keep helping everybody as we're figuring out what the lessons learned are from that.
And I see a hand from Bipasha.
So I just wanted to say to Michelle and Tisha, thank you, because the staff at DOH and HCA are a very active part of our lived experience subcommittee meetings. They've been keeping us updated on what's going on, so the community knows what work is going on in the background. For example, we learned that, the calls that are not answered by the primary call center will now go to another center in Washington, which is a really good thing for people who are calling, because they know they're talking to someone at least within the state. But most, they wanted to emphasize the staff who present, they're excellent professionals, but they also share their own lived experience with great vulnerability. And for me, that sort of highlights something that's really important to me, that the world is not divided into people who help and people who need help, but rather that we are all an amalgam of both those things. So it's important to me, because I want to let people in the lived experience community know that you can learn and become a professional and do the work, and that the work is being done by people who care. And that's important for me to highlight.
Thanks, Bipasha. I think I speak for both Tisha and myself to say how proud we are of the teams. And I know all of us come to this work and welcome others joining us at the state level too, with big hearts and personal experiences that really drive our commitment to wanting to make a difference and serve the people of Washington. So thanks for calling out our amazing staff.
Yeah, thank you. And also, yeah, thank you very, very much. And also just, I can't say this enough, and I know the vast majority of people on this call agree with me, that when you hire individuals and you put them into leadership positions who have been part of the system, it makes things better.
And it makes better the ongoing input we get, especially from those with lived experience and the incredible input we've gotten from the lived experience committee. So thank you. Our work would not be right without that ongoing engagement and partnership.
Oh, thank you, everybody. And thanks for bringing that up, Bipasha, and for giving everyone some insights into how the collaboration is working with the lived experience subcommittee. I see some hands. I'm going to go to Darcy.
Hey, Michelle, I'm curious about the mitigation work group that was on one of your slides. It's going to start up, it sounds like, in the spring. Is there going to be a call out from CRIS committee members to participate?
Is that the geolocation subcommittee?
I think it was something about, I can't remember the exact language on the slide, but it wasn't related to that. It was looking for gaps in the system and mitigating them.
Yeah, Lonnie, do you want to help me answer this question, or we can follow up? But yes, we will. I do think we want input and engagement, but Lonnie, is there anything you want to add?
Yeah, I'm on. I think that was in reference to the RCL and Future State Hub work.
Okay.
Yep, which we plan on reporting out back to this group and others this spring. So we'll keep everybody and definitely want to have continued engagement.
Great, thank you.
Well, would you mind just putting up slide 12 really quick? Let's just confirm. Thank you, Lonnie, for jumping in. Let's just confirm that that's what Darcy was thinking of.
For those who don't know Lonnie, my go-to first person, she is our 988 manager here at the department.
I think it was the next slide that I was referencing.
Okay, can you drop down there, Chloe? This one?
Let me see here, hold on a second. Oh, go one more. Sorry.
Probably even
more.
More, yes.
A lot of slides.
One more. I think it was probably about this work here.
Yeah, about the
cross-agency
crisis lines. Yeah.
Yeah, so the cross-agency work group, the primary participants in that were DOH and Healthcare Authority, the BHASOs and any partners they brought to the table, and our 988 call centers. And that's where the work we're going to be reporting out here later this spring.
Perfect. Okay, thank you.
Okay, thanks so much. Okay, Chloe, you can take that down. Thank you. Kashi.
Good morning. I'm glad that slide was just up because that language was helpful. There had been in the past few months a cross-agency work group, Department of Health and Healthcare Authority, on specifically youth callers to 988 and how we're ensuring that youth are connected, that 988 is not exclusively over the phone resolution of youth crisis, that it's also a strong connection to mobile response in the MRSS system. Some of those meetings have paused, so I just wanted, I think what I'm reflecting back is I didn't see youth massively reflected in this priority list, and that's my job on this committee, is that I sit on the children and youth seat. So I'm going to say I think I need to see youth be a priority here, and I recognize that I sit in a seat of asking for more work, and there's a lot of work already happening, and I want to appreciate that. And I remain really concerned that I've talked to a lot of community members, and I have actively sought feedback from parent groups, from crisis lines and others, and have heard real concerns about how the connection is going between 988 and in-person mobile response specific to youth. So I know that I'm asking for more after you've had multiple slides on the work going on, but I would love to see a project here reflecting youth as a priority. Thanks.
Kashi, thank you. And sorry you had to call that out. That's a huge oversight probably on both Tisha and I that we did not have something about youth, because that is a priority on there. And we are working with our teams. I think there's a lot we're still trying to kind of work on behind the scenes, including some clarity from the federal government around some of the mixed messaging around some of the guidance and where there's some points of conflict. So that work is continuing, and we'll make sure we do a better job of reflecting it and making sure we're updating it. And just thanks for all your support and champion and keeping us accountable to that.
Thank you. And feel free to put me on any interested party list about youth things.
And Kashi, HMA is going to reach out to you, as we have talked about last year, to talk more about how we can embed recommendations for youth and young adults in our report next year. So look for something from us. We're going to want to talk to you about getting more embedded around that.
Perfect. Look forward to it.
And I might suggest we also flag that as an action item so that for our next meeting, we maybe can circle back on what more we've learned about what can be done or what's being done on behalf of youth. So I'll put that in our action items. Okay, any other, I'm going to check the comments here. Any other questions about state agent or comments about state agency priorities, either what you heard in the presentations today or what you read in the newsletter? Okay, well, we're a little ahead of time, which is a rare treat. So I'm going to go ahead and call our break now. We'll take a break. We'll come back. I have 10:21 on my clock. So let's come back at 10:31. I'll give you your full 10 minutes. And we'll move into the presentation from the Lived Experience Subcommittee at that time. I see getting the thumbs up from Puck. So we'll go to Puck when we come back. See you in 10 minutes. Okay, I see folks starting to come back. Give everyone a few seconds to get back on camera. CRIS Committee members, if you can turn your cameras on as you're coming back, that'll just help me track when we have a quorum. Okay. Looking good here. Let's jump back into it. So as you heard, oh, actually, Chloe, can you take down the, right there, perfect. Thank you. All right, as you heard from Levi's welcome remarks this morning, and in reference a couple of other times in the call so far today, the Lived Experience Subcommittee has been working on an idea for how to do deeper engagement with people with lived experience and link that engagement directly to improvements to make in the system, particularly 988 calls. But I'm not the expert on this, so I'm going to turn it over to the person who is, which is Puck on our CRIS committee, who's going to tell you a little bit more about this idea, and then we can have some discussion. So Puck, over to you.
I don't know if I'm the only expert here. I think we're all probably working together to build a thing, but I will represent us the best we can. Hi, I'm Puck. I use he or they pronouns. I've been with you guys this whole time on the Lived Experience Subcommittee specifically. I've worked in community my whole life, trying to support folks and keep us alive, specifically within queer, trans, LGBTQ, and other intersections with those things. So this is a little more, I'm a casual buddy, and I want to talk about some of the work that we're trying to do, and the best way to talk about that, I think, is how we got here. So from Kathy's discussion, presentation, amazing storytelling, I heard a really important reminder, which is that we shouldn't be having to figure out how to navigate the system while we're in a crisis. That is repeatedly something that we keep seeing as a challenge. And so at one of our recent meetings, we had a community member who talked about their own pretty bad experience with the system. And after that, we dug in a little bit and found out kind of more of the logistics of why that had gone so badly. It turns out that a lot of it was that the call was answered out of state. And so I'm really excited to hear Michelle talking about backup calls will now happen in state instead of out of state, because that is, you know, obviously, hopefully, probably you were going to get there and address that. And also, it's really cool for us to see, hey, we saw this problem, we recognized it, and now there's something being done so that that won't happen again. And so from there, I spoke to you guys December, November, I don't know, about my partner's crisis and his not getting into rehab after waiting to get into rehab and all of that. He is in sober housing now, and it was just really another very apparent opportunity for me to recognize the numerous points at which there was something that could have happened to make this less terrible, and it didn't happen. So with all of that, we were also talking about, I think Senator Dingra brought up the idea of a crisis caller's bill of rights. And it also helped us realize, like, you can have a system failure that is an actual, there was something that should have happened that didn't. And then you can also have a system failure that's, I expected this from the system, but that's nothing they ever expected to do for me. And so I think that there are these kind of different levels of systemic issues that we have, some that are about what people's expectations are, and some that are about, are we meeting our own expectations? So I feel like that's information that is really valuable and is something that is kind of hard to capture. So through part of this, we wanted to look at, I call it kind of forensic analysis of some of these cases of what's going on with people, but really just kind of grounding in people's stories and experiences of what's happening. So then we recognized from working in the various subcommittees last year, we really appreciated Michael Anderson Nathy's work of how he was able to support groups of people, help lots of different people be heard, and then also work with HMA to extrapolate some of that information and bring it back to us so that it was usable information. So we have been talking about that with HMA for a while, and we presented it to our community, and we realized our approach was good. And we have kind of an issue where that let's dig deep and go further into these stories approach is also hard for people when we're saying things like, let's look at certain communities and see how they're being affected and how it's going, because automatically when we are trying to look deeper into specific sets of communities, we start to miss communities. We heard Kashi today have to be like, hey, what about the youth? And this is something that I'm constantly yelling, hey, what about the disability community? Hey, what about the trans folks? And I think all of us who are in our lives drawn to representing communities who are less seen have trouble when we're not seen. And so now we're at a conversation point of there's a book called Emergent Strategy that introduced me to this concept of whether we're doing the work an inch wide and a mile deep, or a mile wide and an inch deep. And so we were looking initially at this inch wide, mile deep concept, and now we're just wondering if that's an approach we want to take, or if we want to move more toward that kind of mile wide, inch deep concept where we are trying to get a broader swath of perspective. And so with that as the introduction, Michael, I'm hoping that you can talk a little bit more about what we've been talking about working on.
Yeah, thank you so much, Puck. So again, my name is Michael Anderson Nathy. I use he, him, his pronouns. I'm part of the HMA team. And please forgive me if I sound congested. Despite all of my internal dialogues, my body has decided it should just get sick this week. So I'm struggling with a cold. So I think what I'll do, that was a really great setup, Puck. And I think what we're hoping to do today is just be transparent and share kind of our thinking, or a couple different options for how we wanted to do this, and some of the struggles or tensions that have come up with both of those kind of ideas. And just, I think after I kind of share that, Puck is going to kind of come back and facilitate getting some input from you all, so that lived experience planning group can have some of your considerations as we work through how we're going to do this. So that's kind of the setup. Like if there's a, what are we trying to accomplish in this conversation? It's to get some input to inform our firming up our plans, and then we'll bring a proposal back to you. So again, Puck initially kind of talked about, our initial plan was to, be narrow and go deep. And so we were thinking around, maybe we would identify some key populations that we wanted to understand their experience of calling or accessing 988. And in some ways it made sense to align with some of the populations named in the legislation. And we were going to put out a call and do some outreach and maybe do some interviews and really kind of listen to their stories and ask some key questions to kind of understand the experience and potentially identify some themes across them. And then develop kind of a case study of, several interviews for a certain population group that we would then focus group and kind of do residence checks. And then we would use those kind of case studies to try to identify what Puck said, places where, we didn't meet our own expectations for what we as a system want to be offering versus we didn't meet people's expectations based on what they thought they were going to get. So that we can then work with the call centers and the state and all these partners to kind of try to identify areas for improvement. When we presented that, be narrow, focus on a few key populations, go deep, there was a lot of people who felt left out of that, rightly so, because it was kind of a narrow scope. And so we kind of reconsidered our approach and thought about, again, going that more mild wide and less deep by doing more of a StoryCorps like approach where we would do an open call for anyone who wanted to share their experience or stories of calling 988 to access the system, and have multiple pathways for them to submit their stories. It might be pre-recorded video, audio, it might be written. We would kind of figure all those details. That way, really we weren't narrowing the scope from the beginning. We would just say anyone. There's so much pent up demand to share people's experiences and stories, and there's a lot of pain out there that people need that chance. And so we thought that might be a good way to go. And we realized that part of what we lose in that is that human connection, right? Like we're asking people to share some deeply painful and traumatic experiences. And if they're sending it in video and just sending it out into the ether, and there's no kind of personal connection or response back, but that wasn't something that sat well with the group. I think we were also thinking that that kind of StoryCorps like approach tends to work better for people where there's been more time or distance between kind of the event or events and recalling it. And what we're really trying to do is see what are people's experiences within the last like 6 months or years since we've been doing this. And so not sure if, a StoryCorps approach would actually work. So there's really pros and cons to these different options. And I would say that the questions the lived experience group are raising are the right ones. And we're really struggling with a few tensions that we wanted to name for the CRIS. One is around how do we do whatever it is that we want to do here while honoring the humanity, right, of each other and the people who share. How do we keep that connection and honor people's humanity? How do we do this in a way that doesn't re-traumatize people, right, from the process of sharing your story? There are some concerns about, the need to focus in on certain populations who we do know experience disparities, but also concerns about people feeling left out or excluded from that process if they're not invited to share their story. And finally, how do we balance all of those with the realities of having limited resources to do this work? And so I think with that, the lived experience subcommittee realized that we weren't really ready to say, here's our proposal to CRIS for how we would take stories or lived experience and drive system improvements, but rather we wanted to share some of the discussions we're having and see what your thoughts were. So with that, I think I will turn it back to Puck. And if you need anything from me, Puck, I am here, but I will leave it to you all.
Yeah, thanks, Michael. So yeah, that's the thing. Here right now, we were going to be telling you about, hey, here's our cool project. And instead, let's talk a little bit more about our cool project and why we wanted to do it. So Tisha mentioned interest and excitement in hearing us talk to more people and having this inform the work. And I do think that this is stuff that a lot more of us are interested in probably than have been working on this so far, is the other reason that I really wanted to kind of invite you all to be involved in this process too, beyond just this conversation. I think if I was on the CRIS doing what I'm doing and I wasn't part of the lived experience subcommittee, I would be really frustrated with the CRIS process because I love getting together and getting the updates, but I want to be doing more. And so especially if you are representing any communities, we would really like you to be invited to be involved in the work with us in that way as well. Let's see, I have 80 million notes here. So other things that we wanted to make sure happen with this project are compensating the participants, especially if it is something that is going to be more intensive and asking for more time. We do want to make sure that we're appreciating people's stories and their energy and effort to share them. And then Michael did mention the not wanting to re-traumatize people. And I think especially that's where that piece of the human connection comes in is, every time someone tells their story here, even though we're not officially giving them any kind of response, we are usually having at least Jamie be like, holy cow, thanks for sharing. We are having people visibly, physically respond. And then the other thing that I'm really afraid of is just as we do this work, we really want to hear from the people who have been most harmed by this system so that we can learn from them and improve the system. And hope is expensive is something that I've started really realizing. I had a terrible lawyer trying to help me with my divorce, and I'm really like she needs to be reported to the bar. And I am not doing that because I don't have the capacity to do that because I'm still trying to get through that. Maybe in a couple of years, I would be able to reconcile this and have the emotional distance to talk about that, but not yet. And so when we're having more life dire things than a divorce that's been lingering for 2 years now, it's really hard to imagine people wanting to come and talk, just to their computer, and having the hope to think that that could make any change. So those are reasons that we are thinking a little extra hard about this process, is just because we know this is very tender, and the most tender people are the people that we can most benefit from having this conversation with. So that's one conversation that I would like to have here, is that do we go broader or deeper piece of it? And then the other piece is, one thing really quickly is, since the beginning with lived experience, one of our goals has been not just to have people come to us, but also try to do outreach to them. So that would be part of this piece too, would be going to where people are to try to ask them questions rather than just being like, hello, come here and tell us things. The other question, though, is whether we want to focus, as we do all this work, just on the experience calling 988 or on accessing the crisis system more broadly. So like coming in through the crisis lines or other ways. As we talk about no wrong door, are we looking at what happens when they're trying to go in other doors? So if you have any thoughts on either that broader or deeper piece, or that scope piece, those are things we would love to hear about now. Thank you.
Thank you for setting that up so beautifully, Puck. So Puck's questions were, given all of the criteria that Puck laid out about wanting to, for example, recognize that the people we need to hear from most are also probably the most tender and vulnerable. And so this process needs to be structured to do that. Puck posed the question of, do we go broader or deeper? I'm going to put this in the chat too, so you can all remember. And then the other question is related, which is, do we focus primarily on people's interactions with the 988 or on their interactions with the crisis system more broadly? I see Kim and Puck, you're asking for the CRIS Committee to provide their feedback on that right now. And then I have sorry, go ahead.
Yeah, and then the 988 versus crisis thing, either way, we are hoping to focus specifically on since this 988 process began. I know we have a lot of experiences that a lot of people have had since before that, but we're specifically trying to look at the effects as they have been of the CRIS process so far.
Great, thank you for that clarification. I'll put that in the chat. And then I have a question for you to just noodle on, and we'll come back to you, which is, there are also, I think, community members who are interested in being engaged on this and getting some chats. And so if you have some direction for them on how they might get involved or contact you or Michael, I'll circle back to you on that. So I see Kim first. Kim, go ahead.
Thank you. And thank you, Puck, as always, for your thoughtfulness and these very difficult questions, which I think I'm struggling. So I'm struggling with the depth versus breadth, and I love that sort of concept, the way you laid it out. So I don't know if I have a good answer on that, but I did have some other thoughts, and I was really excited by hearing some of the things you just said. The first was, you asked about sort of, do we look at how other people are entering into this crisis system who maybe didn't go directly through calling 988, et cetera. And I would say, yes, I think that's really key, because I think so many of our conversations are getting to this, like people don't know how, or they're stumbling into it, or they've missed opportunities to avoid even having to get there, right? So I think to have a better understanding of how the 988 system is meeting needs, we got to understand what the needs are and where we're missing those. And, DRW is here, I think, specifically in the role of a organization that works within police accountability. And I would very much be interested in how that nexus is working when the police are like, okay, this person would be better served through, and I'm going to take them to the ER. I'm going to try to find a crisis triage facility, assuming one exists, and I have a relationship with them. Lots of questions there for me. So I think that's great. I wanted also just to flag this question you asked about how to gather people's experiences is so hard. You're right. I mean, this idea that like you are asking folks for that sort of the risk of hope, the like risk of sharing, the connection, all of that. How do you do that in a space they're most comfortable with, that is also effective and efficient and works for everybody? I'll say like, so DRW has this access authority where we can go into spaces that we can monitor. We have federal access authority. And so we often will go into like into spaces where people are being detained through ITA. We go into jails, like, and we talk with people in those places. And I'm wondering if there's an opportunity there to lend that authority, that access authority, to reaching folks in some spaces we maybe didn't think were possible here, if we're trying to gather that experience. So I just wanted to put that out there too, because I think that could be, I don't know, it could be interesting and helpful. So yeah, sorry, ITA is Involuntary Treatment Act.
That's awesome. Thanks so much, Kim.
Thanks, Kim. I see Dylan and then Kashi.
Hi, Dylan, him from Asian Counseling Referral Service. Puck, as you're sharing, I think and I can totally appreciate the challenges and the vulnerability that folks have to feel comfortable with and being able to share their own stories. And Puck, thank you again for sharing your own story and those of your community. And I'm also thinking that can just be kind of hard to formulate that story. How do you want to be able to tell that? And sometimes that will take support, not just time and space from an event, but being able to offer either low cost or very accessible. It doesn't even necessarily need to be counseling, but it could just be a support system that like, hey, I'm with you. And being able to talk through or communicate through a piece there. So, and I think many of us have been in spaces where a testimonial was sort of extracted and there's a snippet and then just used in some way. But if we're thinking through some of the benefits of CBPR or community-based participatory action research, it's the method of, we're looking at how we can actually pay people for their time and also support them through this so it feels more meaningful as they're getting through and that they feel more connected to the work. And then just as sort of a side thought I had for myself, as you're talking about open doors and how other people get through to 988 or crisis services, I'm thinking about the tool of a safety plan. At what, maybe someone does not have a safety plan, or if they do have a safety plan, at which stage did they access 988? Was it a first step, or did some of the other stages in that safety plan somehow get missed, or they just were not available at the time? I think folks that are in the emergency department, we have a lot of primary care needs or things that could be primary care needs that end up getting addressed in an emergency situation. So that wasn't really connected, but I was just thinking about at what point does someone get connected to 988? Thank you.
Thank you, Dylan. Kashi.
I realized I didn't introduce myself last time I spoke. Kashi Arora, she, her pronouns. I sit on a children and youth family seat here and work at Seattle Children's. Puck, Michael, thank you for these questions. What came to mind for me is initially a really strong opinion that we need to be seeking feedback, not just limited to the 988 call. And having had only a couple of minutes to think more about this, I think my preference or ask would be that what we're asking needs to reflect the scope of what we are messaging to the community. That if we are saying 988 is your front door to an entire crisis system, we need to be ready to hear feedback and seek feedback from people on how they experience the fullness of that system. If we go into community and say, this is your front door to a crisis system, we'd like your feedback exclusively on how the phone call went, and I'm sort of dramatizing here to make a point, I think we're really missing what other people might say about what they get connected to or what they don't get connected to, about the role 988 played or didn't in their care, in accessing the next thing that they needed while experiencing a crisis or in post-crisis. And I think I don't have a good answer to the breadth or depth question because my answer would be both, and I think that's probably not what you were asking. So maybe I'll dodge that one. But I think the other thing I wanted to reflect back to this group, which is actually more directed at the CRIS committee than the lived experience subcommittee, is I think part of the philosophy of community engagement is that when you are seeking input or feedback, especially if it's lived experience, especially if it's lived experience that requires a real, well, there are no differences in people's lived experience. It feels right on the border of irresponsible to ask people for their lived experience if we don't have a framework in place for how we will take that feedback into our decision making. And so I think I appreciate that what you have brought here is a request from the CRIS to give feedback on the process of how the lived experience subcommittee will be seeking lived experience. I think for people who will be sharing their lived experience, we as a CRIS committee need to have an answer to how we will use that information before we go into community and ask for that. And I don't know, and maybe this is because I haven't been as connected to this subcommittee, happy to work on that, but I don't know that I have seen a framework for how we take the voices and those experiences and incorporate them in a robust way that doesn't, might have been what you said, take a snippet, right? Like still take that one thing. That maybe those are just, maybe I'll stop there.
Kashi, thank you so much. That is definitely part of that conversation we've been having, even just about the kind of StoryCorps model versus that more interview-based model, is that so much of the power of sharing that story is getting that response. And then further, that response is also what you're mentioning about, is this actually leading toward change? What is going to happen? And that's something that we definitely want to prioritize within our work, is getting feedback to people. But I do think that, yeah, having a more specific outcome that we're working toward could certainly be very helpful as well. I'm hearing a strong argument for the whole crisis system, which I think makes complete sense. I don't understand really how we got stuck on this 988 thing. I think we were just overwhelmed on the scope of what we're trying to do. But yeah, I think we'll definitely go ahead with that. And then we'll still keep considering on that kind of breadth versus depth thing. We had a question about how to get involved, how to get in contact. Can HMA answer that question in the chat with an email address people can get in touch with? I'm just kind of eating up our extra 10 minutes, Jamie, which would give us about a minute or two in case anyone has any extra thoughts.
Wait, you don't need to eat anything. It's but thank you for that. I relayed that question also to Nicola because just for the record, everybody, a few of us have been getting it. The co-hosts have been getting a lot of chats from community members who really want to be engaged on this and some of the other things we've discussed today. So Nicola is working on an answer to all of those questions that we will put up before we end the meeting today. But I would say it's a good sign that this meeting in particular has generated a lot of interest from CRIS members and community members in being involved in this and some of the other opportunities or discussions that were mentioned today. I'm also going to put in a note from Vipasha on behalf of the Lived Experience Subcommittee, inviting the CRIS members to attend meetings so you can listen to the community directly and give input on this project. Next meeting is February 12th, which is a Monday, 1 to 3 p.m. And they're usually on Mondays in the 1 to 3 p.m. timeframe. So, and it sounds like we'll get the dates for all of the upcoming Lived Experience Subcommittee meetings through HMA. So, oh, sorry, go ahead, please.
And that's something that I really hope that as we keep working on this CRIS process is maybe we can include a piece to this meeting that is like, hey, here is other CRIS work that is happening so that we can try to be more integrated with each other doing this work. I never know when the steering committee meeting is because I don't pay attention to that. If it was mentioned here in the meeting, maybe I'd pay attention to that. So yes, please do feel welcome at our lived experience subcommittee meetings. We love anybody to get involved if possible.
Great suggestion, Puck. I think that newsletter and some verbal communication can continue to be a good way to make sure that everybody is aware. We all have different ways of taking in information and communicating. And so I think if we're using the multiple tools that are available to us, we can start to connect those dots well. So thank you so much for that. CRIS committee members, any other feedback for Puck and the lived experience subcommittee on as they're working out the details of this approach? Alicia.
Hello, my name is Alicia Morales, and I am relatively new to this committee, so thank you. I use she, her pronouns. And so I just, for clarification purposes, when we talk about the broader crisis system, does that also include the 911 system? I know I've heard a lot of communication about 988 and about the regional crisis lines, and I oversee a program that currently exclusively supports people experiencing behavioral health and substance use crisis within the 911 system, and there are a lot of calls in that system. So I just want to ensure that if we are talking about how people are engaging with the crisis system, that we're also incorporating their engagement with the 911 system and the way that they're receiving services, because sometimes people have, they call 911, they receive support from the program I oversee, and then we connect them to 988 or the regional crisis, but they receive services and support, so they don't necessarily need to loop into those services or to those resources immediately right away. So I just want to know if we're also including the 911 system, because a lot of people call because they know that somebody will come or someone will answer when they call 911. And so I just want to ensure that if we're talking about the full experience and I guess like the mile-wide approach, the broader approach, that we're looking at all the ways in which somebody may have engagement with the crisis system or services. Thank you.
Thanks, Alicia. Yeah, I think this is what I meant when I said we kind of got overwhelmed by the idea of the whole crisis system. But to me, just following the no wrong door logic, following the logic of any way you try to get help in your crisis is crisis response, right? I think that the scope that we have any hypothetical control over is this broader 988 / trickle down / regional crisis line thing. And also we are, as we all know, working strongly in collaboration with 911. And I think probably anything that is a 911 call that involves some kind of like mental health, behavioral health crisis would be within the purview of this project.
Thank you.
All right. I see Bipasha.
I just want to highlight one thing that Puck brought up, and as did you, Dylan, which is our hope and intention of compensating people, even, in some kind of nominal way for sharing their stories to impact the system. So just going to put that out there. It's a discussion to be ongoing had, but wanted to put that out there. Thank you.
Thanks, Bipasha. And I got a message back from Nicola that probably the most streamlined, the best approach is to have everyone message her. And I think we'll probably need an email address as well for folks after the meeting. So Nicola, if you don't mind putting, just reminding folks in the chat and chat to everyone, and you can maybe put if it makes sense to do this to the HCA mailbox, if people would like to connect after the meeting, if you could put those in the chat and everyone can look out for that. And we'll do the triaging and supporting to make sure that Lived experience subcommittee gets the ones related to this conversation. DOH gets the ones related to some of the opportunities that they put up, et cetera.
Yeah. Jamie, I just wanted to encourage people to specify what their interest is in terms of lived experience, because we have the general be part of lived experience conversation, which will be when we take what we've crunched from this and some other planning conversations back to our regular lived experience subcommittee kind of work group meetings. And then we also will be having that smaller group that's going to do the crunching and planning of this project more. And if that's something that you are excited about being involved in this particular project, that would be probably the better fit for you. If you're an area expert in one of these things we're talking about, that would be the better fit for you probably. So please let us know what kind of thing you want to do.
And Puck, do you have a rough timeline of when you, because I know, I just want to acknowledge that there's a lot of information that people are taking in the meeting today, and they may need to do a little bit of processing before they respond. Do you have a timeline by when it would be good to hear from people if they are interested, particularly in that second group you mentioned of people who want to help shape this?
Michael or Nicola, do you have an answer for that?
Well, I think that little subgroup of us who have been meeting, we're hoping to develop a proposal in in the next couple of weeks so that we could bring kind of the fleshed out proposal back to CRIS in February. So that would be soon, would be my guess, which so and of course, you know, we need to be flexible and you know, meet people where they are. So if we need a little bit more time, we'll have to like re-strategize that.
Okay, so it sounds like sooner rather than later, if you want to be interested in that, and if you're interested in participating in that group that's shaping this. But I think it sounds like if we hear back from folks in the next couple of days, that's fine. Okay, great. So again, if you have been listening today and you're a community member and you'd like to be involved in this process, please send a chat to Nicola and with your name and contact information, Nicola Pinson. You'll find her in your chat. And clarify, if you can, what you're interested in particular. That will really help Puck and Michael and Bipasha and others figure out how best to engage you in this process. Okay, I'm just gonna, sorry, I'm terrible at multitasking. So I'm gonna just forward one more chat message to Nicola. Okay, and then I will. All right, and Nicola has just put in the chat to everyone about reaching out to her if you're interested in engaging with lived experience subcommittee. And then Nicola, if you could also, if you don't mind, just putting that HCA project, CRIS project email in there, that would be great.
Yeah,
There you go, it's right there. Brittany put it in. Thank you. Perfect. So if you think about something after this meeting, after the chat's shut down, that's your opportunity. All right, Lived Experience Subcommittee, and Michael, thank you so much for a great presentation. Clearly, you've captured the interest of a lot of people because we're getting a lot of chats of people excited about this. And I am really excited to hear the report out and learn more about what you uncover. So thank you for that. Let's move into our discussion of CRIS priorities for 2024. So our objective for this particular action item, we're laying the foundation for 2024. And what we want to do today is take what we hear from CRIS committee members to inform 2024 CRIS plans as we lay out the year. To set this up, I'm going to ask Betsy to share a draft overview of how the high level of how we see the year proceeding with the CRIS. And I'm going to ask Chloe to put those slides back up so Betsy can walk you through.
Thanks, Jamie. Happy New Year, everyone. End of January. I'm Betsy Jones with Health Management Associates. For those who don't know me, I'm leading the process around facilitating the work that we're doing here at the CRIS and with the steering committee and the subcommittees. So I'm a little bit the process queen and want to share with you the committee decision process map for 2024 to provide an overview of key topic areas of focus this year. And we're going to further incorporate your input based on the decision, or excuse me, based on the discussion that we've had today. So this is a draft, and this is our best thinking of the foundation setting. It's based on legislation from 1477 and 1132, from the priorities that we've heard from legislators, agencies, and lived experience CRIS members regarding their key priorities and focus areas for the work that they're undertaking this year. So building on this work and the committee recommendations that were laid out in the report last year, we've outlined topics for this year that have a focus on system quality and oversight, crisis system funding needs, and system infrastructure, which includes cross-system collaboration, the technology platform, and staffing and workforce. So these should not be surprises to any of you on the CRIS. We've talked about all of these real foundational elements over time, and we're here in 2024 to address them. In February, we'll begin our discussion of system quality and oversight, and then continue that discussion, because it's a big one, at our in-person meeting in April and at our meeting in June. In March, we would like to focus discussion on system funding needs and the status of work to address the service gaps that you all identified throughout our discussions last year. So we had lots of robust discussion about services and service gaps, and we want to bring forward some conversation about what state agencies are working on to address those service gaps, with exciting opportunities for funding, as well as where we still may have gaps in needs. In July, we're planning to focus on bringing forward updates around each of the system infrastructure areas, again, cross-system collaboration, the technology platform, and the staffing work group. This spring, we'll be engaging subcommittee and work groups in each of these areas. So as you all know, we've had subcommittees, and last year we turned more to the CRIS work and engaged less of the subcommittee work, with some exceptions, lived experience being one of those exceptions. But we'll be turning back to subcommittee and work groups, including discussion of some of the state agency work that you earlier heard about in the highlights from Michelle and Tisha. Next slide. And moving into August, we'd like to take a special focus on lived experience stories to inform system improvement. So all of this discussion that we just had from lived experience on understanding perspectives, experience, and gathering stories will be the focus of August. We don't have a CRIS meeting in August, so it's not going to be bounded by our regular 3-hour meeting time. And we're hoping to make this a real robust opportunity to dig into what we've learned during that August timeframe. Yeah, so we'll keep you updated on the planned approach for engaging these stories as we develop more of a program. And then in September, we'll convene again in person and begin the process of reviewing the committee's synthesized recommendations for 2024 and the final report to the legislature and governor. Although, as we heard, this may not be our final report, as it appears that there's a possibility that our committee work will be extended into next year. So that is our proposed process. And again, we're going to be taking the information and the input that we heard today and tweaking as we need to. This is always a dynamic document.
Thanks, Betsy. So Chloe, do you mind taking that down? Thank you. All right, so I'm going to set up our discussion now. As I said, what we really want to do is use your input to refine and lay this foundation for 2024. So reflecting on, if you can remember, all the CRIS recommendations that we came up with last year, and what you learned today about legislative session and about the work that the state agencies are doing and the lived experience subcommittee's plans. What are key considerations that you want to make sure HMA hears to inform our priorities for the CRIS in 2024, and why? And I might kick off by saying I heard Kashi call out earlier that she didn't see youth represented in state aid and addressing the needs of youth in that. So I might seed our discussion by saying, I'm going to guess that that's certainly something that should inform our priorities for 2024. Kashi, please correct me if I'm wrong.
Nope, I agree with that. And that saves me from sticking my little Zoom hand up. And I think that I would love to see that across the buckets that you just described for the work, right? I think I've had lots of questions about how we're getting data on youth, for example. And so when we think about system metrics and what we're reporting out and what we're being held accountable to, would love to see a youth lens there too. Thank you.
Thanks, Kashi. Do others have thoughts that have come up for them today as we've been talking? Michelle.
Hi, good afternoon or morning, late morning, everyone. I wouldn't be able to be in this meeting without taking the opportunity to again just ground everyone in the fact that this work is done by hopefully talented and diverse human beings. And I've been listening really closely today and I really appreciate all the discussion and the questions. And just a reminder, anything that we can do to try to attract, retain, provide equitable wages, all the process work that we do, all the planning, all the growth is amazing and fantastic. It's progress, not perfection. But I think not all of our issues and struggles are rooted in the fact that we have still a tremendous amount of turnover, high bar to get into this work, and a really high burnout field. So I stand behind our staff and volunteers that every single day they do the best they can. And the more we can elevate to make sure that we have, again, a stable, diverse, representative workforce, I can't emphasize that enough. So thank you for letting me comment.
Thanks, Michelle. And I'm guessing in particular, when we get to that funding need discussion in March and the workforce discussion in July, that in particular we'll want to pay attention to these topics. Does that sound right to you? I mean, I assume we'll do it throughout the year, but I'm highlighting some particular areas where I'm seeing that. Thanks for raising that. I know that's been a call for you in a lot of our discussions, and I'm glad that you keep raising that to the surface.
Thank you, Jamie.
Puck.
I was gonna say a lot of what Michelle said, actually. I've been thinking a lot lately about the workforce and watching my friends who are social workers burn out, and thinking a lot about peers as well, and worrying about other people's perspectives on peers entering the field. I think people have fears of peers being unqualified. And I don't think that's true, but I also think that we do need to make sure that we're training our peers appropriately for each circumstance and that we're using our peers appropriately, because I've heard that that might not be happening. So I think both as a CRIS looking a lot at employment and also how we're supporting our peers. I don't understand why we don't have a partnership between the Department of Vocational Rehabilitation and the peer job position. Like implicitly every peer is a disabled person. Why aren't we supporting them? So if anybody is working in those areas for your jobs as well, please feel free to reach out to me. I would love to talk further about those things too.
So Puck, I'm hearing, and this has been a call that you've made frequently too, about addressing the need for peers and also the stigma against engaging peers in this work and making those connections with where we can find peers, like your suggestion about Department of Vocational Services.
But also really incredibly strongly support. If your job is going to be based on you being in recovery from your mental health stuff, what does that look like? And how are we making sure that you stay in recovery while also burning you out with this work?
That's such an important point. And I have heard you make that too, about how we support the people that are doing this work too. So thank you for that. Vipasha.
I just want to say that I'm heading over to my volunteer shift after this, and I want to give a big shout out to my supervisors who are there supervising the work that I do. I know what Michelle means. They're excellent workers, and they really do need to be compensated well and consistently. So the system needs to have funding in place always so we get the best of the best doing this work, but there is a high burnout in doing crisis work. The communities I would like to highlight, I would like to echo Kashi saying youth and families. We want to also focus on that in our lived experience. We heard from Kathy earlier, so please, on the substance use crisis that's going on in our state, we need to focus on that and get more information to the community as we got updates on what DOH, HCA, and the systems are doing to support those individuals and families. Another group that keeps coming up and came up very strongly in our January Lived Experience Subcommittee is the intellectual and disabled community. You know, we can't just design a system for someone like me who speaks English and is capable of communicating and all of that. We need to design a system that really holds space for all kinds of people, immigrants, people who don't speak English. You know, that is brought up also very often. And in terms of the intellectual and developmentally disabled community, there is a theme that's come up in the past 3 years of doing this work. I'm going to speak it. It's a very sensitive theme, and I want to work with people across the CRIS and in our lived experience, which is that space where friends and family feel that they are not given enough information because we are trying to honor the rights of the people who are directly in the process of getting treatment. And it's a very, very tender and sensitive area. And I think we really need to have an honest dialogue about where it is we draw lines for someone like me, who is the person with lived experiences, versus, let's say, a parent of mine that wants to get involved. And Kashi has brought up, we have 3 buckets. We have below 13 in Washington State based on the law. We have 13 to 18, and then we have adults. And we know there are parents of people who are in all 3 categories trying to navigate the system. So how do we protect the person who has the lived experience, who is living the crisis right now, while also supporting friends and family? Because someone said something at that lived experience meeting on in January, which really hit me, that even if I have conflict with my family, it's not unusual for me to turn to my family for support. And so how do I get honored as a person and be protected? Because not, as Puck often says, all families are not safe places for people to go to. We need to know that, but how also do we empower families and friends in a healthy way to support the person? Because without the community, we're not going to be able to do this work. I speak from the South Asian perspective. If you do not support the community and the family members, they're not going to be able to support the people who are in crisis. And as I can say, as an immigrant who came here, I didn't know the laws over here. In India, people get into your business, you know, and they do stuff. Whereas when you come here, there are boundaries. So that's a very sensitive topic, and I would like to talk about that in the CRIS more openly.
Thank you for raising that, Bipasha. And I'm hearing a common theme across many of the comments that have been made today about, Michelle kicked it off by talking about needing a supported workforce. And I'm hearing Puck and Bipasha say, it's that, and it's the communities that surround people. It's the people that are giving care. It's the people that are maybe dealing with crisis themselves while they're supporting other people. And that, I think when we're talking about, we've talked a lot over the years about system gaps and where we need to make changes, but it sounds like as we're starting to really dig in and address those details, you want to make sure that remains top of mind as we're talking. So thank you for that. I just want to make a quick reminder, especially for folks that might have joined a little bit later today. I am getting a lot of wonderful chats from community members. Unfortunately, I'm a terrible multitasker. I need to focus on facilitating the CRIS committee, so I'm not going to be able to respond to chats from community members while I'm facilitating the CRIS. And I'm also just going to remind everyone, I'm going to ask CRIS committee members if it's available to you, if you could turn your video cameras on, and community members, if you could please turn your video cameras off. That just allows me to focus on CRIS committee members when we have 85 people on the call. One more reminder, we have one person signed up for public comment today. If any of our community members have something that they would like to say today, please send a chat to Brittany Thompson, and we will call on you during our public comment period at the end of the hour. We'll be starting our public comment period around 11:48. So please do, if you do want to make a comment today, that would be the time to do it. You are also, of course, welcome to send anything written to the project email box, which we put in the chat a few times today. So sorry for that public service announcement. I'll go back to our CRIS committee. So we've heard from a few CRIS committee members to lay out the foundation for the coming year. You know what, Chloe, if you could just go ahead and put that slide up that Betsy walked us through one more time, the decision process slide. I think it might help folks, CRIS committee members, to see that one more time, and then I'll ask the question again. Okay, if you could go up the slide right above, that would be perfect. Perfect. Okay, so CRIS committee members, back to my question. Based on what you're seeing here and everything you've heard today, are there any other key considerations that HMA needs to hear, that we need to hear to inform what the CRIS does in 2024? Darcy.
We'll be curious next month when we start to talk about quality and oversight, what the thinking will be about the convenience of using easy to obtain measures versus the measures that will actually tell us if things are going well or not. And so I hope that we'll have some time to have some conversation about the tension between that, and also that we look at performance across the continuum and how we can make sure that everybody that has a part in it has the opportunity to show their contribution to the progress.
So Darcy, I'm hearing you say we need to navigate that tension of having data that's easy to collect and digest, but also making sure we get actual insights about how we're doing and really measuring our performance. And
right,
then,
exactly, yeah.
Okay, and then also making sure we're looking at performance across the continuum, not just in, say, like mobile crisis response or one piece of it. Okay.
Yeah.
Great insight. Thank you. CRIS committee members, other thoughts here? Vipasha.
I'm going to say this again and again. We need input from people who are actually utilizing the crisis system. Also, we tend to always leave them out. And we talk about this in our lived experience subcommittee meetings, is that when you buy a product, the business wants your input on your experience of how was it to order? Did you get support during customer service? So I strongly support the idea of tapping into people who use the crisis system to give us input on what that was. I mean, we have this lived experience subcommittee, but there has to be a way for people to be able to rate their experience of the crisis system.
Thanks for that reminder, Vipasha. I really appreciate that. I am also just sending some direct messages to a few CRIS members who have a particular area of expertise or point of view on this committee. So you might see something from me asking if you think of any insights either in this conversation or maybe afterward, please do share those, because HMA is genuinely interested in getting those insights as they're refining this work plan for the year. Linda, nice to see you. Oh, Linda, you're on mute.
There we go.
Perfect.
I'm not sure it's relevant, and I have to admit I'm so overwhelmed with some other tasks right now that I'm not totally here. But one of the things I worry about is that an important part of the crisis system is the detox programs, the withdrawal management programs, especially with the drug crisis that we have. And we keep seeing them diminish. This year we lost a few more. I closed one of mine a year or two ago. I've got one last one that loses $1 million a year. And I just think that we're losing an important resource, and we get focused on the mental health, which tends to be more outpatient, or, the crisis response centers. But there's a need, because people who are toxic may at least be temporarily appearing to be mentally ill, and then when the drugs are out of the system, not so much so. So I think that we need to address where that fits in the structures, and how are they being brought in to the crisis system?
Sorry, Linda. Hey, folks, if you're unmuted, can you please mute your mic? It's interrupting our speaker. Thank you. Sorry, Linda, please continue.
Oh, that's fine. Yeah, I would like to see the mental health system recognize the role of the withdrawal management programs, because, you know, we set up secure detoxes. Not everybody has to be in a secure detox. A lot of people come voluntarily. And so we need to recognize that every day we're dealing with people who have what we think is a fentanyl psychosis. We're seeing people who, once the fentanyl's out of the system, don't look so psychotic. And so there's a tremendous overlay between the withdrawal management system and the rest of the mental health crisis system. So I keep hoping that somewhere along the line we can address that. I realize that we have to get the cement in place and create the foundations, but it is a piece that worries me. We see 1,000 people a year, and probably half of them these days have tremendous symptomatology.
And Linda, just to remind folks of your role on the CRIS Committee, where you come from, can you say a little more about who you are and Evergreen Recovery Center?
Well, Evergreen Recovery Centers is the largest SUD program in North Sound and maybe in the state, very close. And we have a whole continuum of care. We used to have a detox in Everett as well as one in Linwood. We had to close the one in Everett because we couldn't find enough nurses and couldn't afford to pay the $50, $60 an hour on the vendor rates that we get. We're at that level now where our board is making motions to close the next detox program, the last one. And we lost an important detox program in King County last year, not Evergreen, but another provider. And I'm just worried about where these people go. And they're probably going to more expensive programs that are more generalist, like emergency rooms. And so everybody gives lip service to how important detox is, but there is not a focus on it. And it really is part of the crisis system, which is my interest in CRIS. Is I see, and I've spent 50 years, my first job was in a detox program. And so I see detox as the entry point and the crisis program for alcohol and drugs for people with substance use disorders. So I just keep feeling like we belong somewhere, but so I'd like to see if there's a way to put some focus on their role and what we bring to the table. And ours is a medical detox, and we have psych guarantees, and we have all of that. And we provide youth detox, and these are both mostly homeless youth. So I think that they're an important part, and I don't think that Evergreen is unique, but there's only about 4 of us left in the whole state. At one point, we had over a dozen. And so we're dying, as I say to the HCA, we're the canary in the coal mine. And part of it is just lack of funding. We cannot keep up and compete with the hospital wages or the governmental wages. And so we struggle to keep the staff that we need.
Linda, thank you so much for raising that issue. You were talking specifically about detox programs and their relationship to the crisis response system. I do want to call out that Michael Robertson, who's one of our lived experience members on this CRIS committee, talks about needing to focus more on substance use disorder and in this continuum, that we don't talk enough about that. So I know he would be cheering you on if he were here today. So thank you for
I've heard him too, and I cheered him on quietly.
Yeah, it's good that you're cheering each other on together. I also want to acknowledge a chat I received in response to what you were sharing, coming from Bipasha. She says, this is worrisome to hear what Linda is saying. We keep talking about new services while good current ones are falling apart. And I think that's echoing what Linda was sharing with us. So thank you so much for raising that. Alicia.
Hello. Again, I realized that the last time I spoke, I didn't provide any background as to what spot I'm taking on the CRIS committee. So I am fulfilling the CARES, so the fire department with a CARES program. And so I'm with the Tacoma Fire Department, and they have had a CARES program since 2012. And then in 2023, they launched an alternative response program, which is the program that I co-manage with another lovely human being. And so our program functions within the 911 response system. And I think that I definitely agree with what Linda is saying. Resources, especially detox, when we go out to support people who are calling for support, it's not just behavioral health support, it's also substance use support. And so our team is supporting people who are looking for services. And if the services don't exist, then people really get stuck. And they just constantly remain in that state of crisis and need of support. So I definitely agree with Linda. I also just want to say, from the 911 standpoint, for the fire department, they are constantly going out to calls in relation to behavioral health and substance use. And so there has been a large push by a lot of different fire agencies to determine how they can support substance use crises by building their own medication assisted treatment programs in which they're administering services to people to get them that initial support and then connecting them to other resources if they're available, so that people aren't going through the emergency department. So I don't know how we can also loop in that component where people who are having access or who are accessing services through the 911 system are also being heard and are also being counted when we talk about their experience with behavioral health and substance use crisis. Because I think that when programs and fire departments or EMS agencies start to grow their support services, it's outside of the traditional behavioral health agency approach. And I know that a lot of fire departments are looking at how do we become behavioral health agencies. The Tacoma Fire Department used to be, and we are working towards reestablishing that to offer more support for services, and then also to receive funding for the services that we're providing, because we know that if someone's calling 911 and these services are being provided just because we're providing those outside of more traditional means, that doesn't mean that we're still not providing that support. So just in how do we capture that full spectrum of services and the way that people are contacting and receiving supports?
Alicia, you hit a point that's come up many times in this process, which is that so much of what's happening out there isn't fitting into these boxes that we're discussing. And so I think when Nicola and I met with you a few months ago to do your orientation, we were talking about these very things and how valuable your expertise and your kind of cross-system expertise is going to be this conversation. So thanks for raising that. I also I got a chat from Adam Wasserman, the state 911 coordinator on our CRIS committee, who's offering that we can't forget 911's role in the crisis system, and we need to continue the cooperative work, especially with the joint 988 911 initiative. Michelle Roberts was talking about that earlier today. And he adds, Michelle McDaniel's been an awesome partner and a total rock star. So just put that out there. Thank you, Adam. CRIS committee, any other thoughts? I think I've heard from the majority of you today on your input. And for those of you who need some time to process and think about it before you offer thoughts, or if you please feel free to email later and we'll be happy to incorporate that. Maybe you heard your opinions expressed by another CRIS committee member, which is also great. Any other feedback from CRIS committee today? Betsy, Nicola, do you think you have what you need to continue refining this? Are there any questions you have for the CRIS before we move on?
No, this was a fantastic discussion. Appreciate all the feedback.
Me too. All right, I'm going to check with Brittany. It sounds like the one person we had signed up for public comment may be having connectivity issues. So Brittany, am I getting that right?
Yes, she messaged saying she was in and out due to connectivity issues. I do see her here though now.
Okay, why don't you, we'll do action items and next steps. If you don't mind just checking with her via chat to see if she's still up for it.
That's good.
We can go into public comment after we do action items and next steps. So everyone, first of all, Chloe, if you could take the slides down, that would be great, please. CRIS Committee, thank you so much. I take from Betsy's response that she feels like we've got a lot of good content to help refine this work plan for the coming year, this decision process for the coming year. So thank you so much for your engagement in this discussion today. Let's run through our action items and next steps. Nicola, anything to share on that?
Thank you, Jamie. Yes, I can just run through the action items on my list right now. So number one, as we included in the chat, if you are interested in engaging in the lived experience subcommittee or the lived experience stories project or other work highlighted today, please email the HCA program email. I'll put that again in the chat for you all to send that. You're also welcome to send me a chat during this meeting, and I have received several outreaches and I've included your email for follow-up. HMA will also confirm the status of the agency work group focused on cross-system coordination for youth, per Kashi's question earlier, and we will also be incorporating a youth focus into the committee work this year as discussed. HMA will also follow up with CRIS members to send the lived experience subcommittee meeting dates this year. So you'll see a note from us on this, and these meeting dates are also on the CRIS website for members of the public. So those dates have been calendared. And then finally, we will be incorporating all of this great discussion today into the CRIS focus areas for the year, as you all mentioned, or as you mentioned, Jamie. So HMA will be doing more work on that, and updates to come at the next meeting.
And the only thing I'd add is we'll all stay tuned on the deadline extension bill that Senator Dingra mentioned, since it will presumably affect all of us in our timeline. So we'll keep you posted on what we learn on that. Okay, CRIS Committee members, did we miss any action items that you heard? Did I get it at all? Okay. Great. All right, well, I'm going to move into our public comment period. We have one person signed up for public comment today. It sounds like she has been able to connect to a hotspot, so is able to participate. Just a quick reminder, we invited community members to sign up via chat to make public comment. I'm going to do the comment clock for 2 minutes. I'll have the clock up on the screen. CRIS Committee members will not be responding to public comment, just listening. Karen, if you have any written comments that you can submit, please do use that email address that Nicola's putting in the chat, and you can submit it, your written comments. That'll just make sure we have all set for the record. And I think that's it. I'm going to go ahead and share the screen with the clock, and then Karen, you may start when you are ready. So you're on the camera, so.
Yes, and I also am not a multitasker, so could you once again say who I would send the written to?
You know what? We'll put the email in the chat after you're done speaking, so you don't have to try to multitask. How about that?
Sounds great.
Okay, go right ahead. 2 minutes.
For the time, I do have just a few important points I'd like to highlight and share a lived experience voice on. First of all, I appreciate and love that we have an opportunity for you. Folks have created time for real stories like Kathy. What she shared today was just beautiful, and it's so imperative to bring the strength-based positive changes in the work that we need to have those real stories. And I do genuinely appreciate the time given for them. Second point, I did want to say that I do believe that we must continue the work of ensuring state testing and certifications are relevant to the real world work being done at the service level around that social work discussion we had earlier. I'd really like to see accessible supports to set testers up for success, including a tutoring program for those who feel the need for that extra support, as well as scholarships for those who are unable to access testing or annual certifications due to financial challenges. I personally know Kristen, and she is an incredible lived experience, passionate, educated, important person in this work. And to hear that she had challenges kind of hurt my heart. And I'm super glad that she was able to break through those and do the work that she does, because she's impacting people every day. Third point, I'm going to hurry up. I'm thrilled to see the chart of priorities each month, as I believe it will help the work be concise and relevant. And so I just want to say thank you to everybody who has spent so much time on this work. You're doing a great job. Finally, I want to appreciate that the opportunities that Puck shared on that lived experience committee and the reminders he gave us about the peer worker challenges that we want to address. His words are truly relevant and impactful, and I hope that more families will answer his call. I love the hope is expensive statement that he made, such an accurate way to describe what it can be like to hold hope. And I support him, and I ask us all to use our influence in the circles we do life in to bring more of these stories. I have relationships with people who have experience, even though I don't have that experience with crisis response in 988. I know people that do, and I'm going to encourage them and support them to share. I accept that challenge. Thank you.
Thank you so much, Karen. Nicola just put a post in with the summary of action items, and I'm going to repost that email address to send your public comment, your written version of comments, and any other CRIS committee or any other community members who have comments they want to make today. We still have a few minutes left in the public comment period, so I'm going to open it up. If there are any other community members who would like to make a comment in 2 minutes, please raise your Zoom hand. Okay, I'm not seeing any. Oh, I do see a hand. So I'm going to take Rochelle Madigan. I'm going to put Rochelle, I'm going to put the clock up. I'm going to reset it for 2 minutes. It looks like we'll also have time to take Elsa Daly's comment. So we'll start with Rochelle and then Elsa. Let me put that clock up again. Bear with me just a moment. I'm resetting the time. And then Rochelle, when you're ready, you can turn on your camera and go ahead and start speaking.
Hi, I'll be brief. I won't need 2 whole minutes, but I just wanted to say I did send an email with a letter that I have written, and I'm hoping that my question is when you mentioned earlier that written feedback could be received and would be shared with the whole group. Is there a feedback loop in which I can expect a response to that, and what happens with the information? Will everyone in the CRIS committee get to see that information?
So just a reminder, and I'll give this to you, Rochelle. So these are public comments, so we don't respond to I'm actually breaking the rule and responding to your question, but it seems legitimate to do that. We don't actually respond to the comments, but they are compiled and sent to all of the CRIS committee members. And the intention is that they are taking all of that in, and it is informing their deliberations. So thank you so much for speaking today. I appreciate it. Was that the whole of your comment, or was there anything else you wanted to say? I want to make sure you get the whole time.
Well, just share since there is a broader audience so that folks are aware. My comment was around the way that community experience is engaged in this space. I feel, and I am not alone in this feeling because I've spoken with a number of others that share my sentiment in this, but I feel that we have some work to do in this space in being in alignment with system of care values and the way that we're engaging voices of lived experience. The fact that we have a subcommittee that's a side lived experience subcommittee, I believe that lived experience should be in and through every element of the work, and not as a side group that is it can feel kind of gatekeepy. Even this 2-minute timer, like in the early parts of the conversation where there were legislators present, community members weren't able to speak during that time. We're reserved till the end after everybody's gone. So I just feel like we have some work to do to make this feel like it's a partnership and an authentic relationship and not, a side element. Thank you for listening.
Thank you, Rochelle. I'm going to reset the timer. I see Elsa Daly with your hand up. Elsa, when you're ready, go ahead and start speaking.
Good afternoon. My name is Elsa Daly. I am a certified peer counselor, SUDPT, and a behavioral therapist, as well as a paraeducator. My concerns are the same as the last speaker, is that lived experience, I feel, was frowned upon with the gatekeepers or the higher individuals who are more on that doctorates and, you know, degrees, and that's great and wonderful. But what I've noticed, just even with my lived experience, I'm 51 and I'm a professional. So I'm going to come out of the professional aspect, is when I go and I'm trying to get help, I'm looked down and frowned upon. But when I go in and I have my badge on, I'm getting treated with respect. I'm going to take it from the other side for my families that I worked with in the wraparound programs, and have seen a lot of judgment towards families coming in and out of partner systems, being judged, being ridiculed, and services not being helped. For example, last Friday, I went into work source with 2 teens. And when I say teens, to me, 19, 18, that's a teen, but apparently it's a young adult. And I was just doing my own stuff, trying to get my own services. And they were referred up from DSHS in Aberdeen up to the work source. And as they went in asking about the work source and, you know, some of the resources they can use, they were told that their agency doesn't give out handouts. I was taken back by it, but it is not my personal business. So I just sat to the side and I listened. As the young man continued to try to stand up for himself, they were told that they need to leave because they're trying to get handouts. So I had to stand up and let them know that I work with Washington State Community Connectors. And these are the things that we're trained. When you see something, you say something.
Thank you so much for speaking, Elsa. Let's see. Is there anyone else who would in the community who would like to make a comment before we close out today? Okay, I think that ends then our public comment period for today. A reminder again, community members, if there are any other comments that you would like to make, please feel free to send a written version to that email box that we've put in the chat a few times. It's also on the CRIS Committee website. I just want to extend a huge thank you and appreciation to the CRIS Committee and so many members who put in a lot of effort to prepare for today's meeting, to participate in today's meeting, to share your expertise. And as always, a huge thank you to the community, to community members who take time out of your day to observe and engage in these meetings. Betsy, anything you want to say before we say goodbye?
Nope, just echo your sentiments, Jamie. Thanks for joining us this morning, and we'll see you soon.
Have a good rest of your day, everyone. Take care. Okay.